at the Southborough Advisory Committee meeting to order at 6:32 on February 24th. Let me get my language up here. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southborough Advisory Committee will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and our requirement to attend this meeting can be found on the Town of Southborough's website at www.southboroughtown.com. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner by finding the meeting at www.southboroughtown.com/remote meetings. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on Southborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. All right, we got a busy night, so let's go. So we're going to start, guys, with Board of Health at 6:30. So we've got Mary Lou, the chair of the board, and we've got Heather. So it's Alker, right, Heather? Okay, so you're muted.
Exactly, Alker.
So Dr. Heather Alker. So she's with us also. And they do not have a quorum, so they did not have to call the meeting to order. So Mary Lou and Heather, I just want to turn this over to you. We'll ask questions. So you've got about 45 minutes, and then we'll have 15 minutes or so for questions. And again, you know, we're trying to understand the need to make these positions permanent, which, as you know, is a huge increase to your Board of Health budget. So my guess is not everybody's read everything that you sent that are forwarded this morning. So we'll have a chance to read that. We're not going to vote tonight. We just want to listen and make sure we've got all the information we can possibly get from you so we can make a decision, because we do have to make a decision soon as far as our recommendation. Okay. All right. So Mary Lou, I'm just going to turn it over to you, and you can kind of guide how you want this to go.
Okay, thanks. So I think I wanted to start with, I realized in meeting with you and other people, a lot of people don't know my background. People know that I'm a nurse, and that's all they know. And I am a nurse. That's one piece of what I do. But when I graduated from college, I worked at Mass General for about 15 years. And then, so I did hospital-based nursing, but then I went into public health. And I spent 20 years at the Department of Public Health in Boston. Overseeing many different programs, working with municipalities, working with CDC, working with many other federal agents, HRSA, many other federal agencies. I've spent most of my career in public health. Since 2012, when I left the Department of Public Health, I've been doing education and training around public health issues, healthcare issues. I teach at Northeastern University in public health policy, and community health. So all of what I'm talking about is something that I live and I know very well. I also just took on a role with the Department of Public Health to help them with the implementation of the blueprint across the Commonwealth. So this is all information that I live and breathe all the time. Also, my mom grew up in Southborough. I've been in Southborough for almost 30 years. Southborough is very important to me, and it's important to me knowing that I will be probably moving out of town sometime this year, that I'm able to help Southborough get the core staffing that they need to move forward for today and for the future. So I thought I'd kind of just start with, like, the status quo of public health is no longer acceptable. The COVID-19 pandemic has shown us all that Southborough Health Department is not adequately structured, staffed, or financed. The pandemic has put us in the spotlight on the gaps and the deficiencies that exist in local public health all across the state. We're not alone. Many other municipalities are facing the same issues we're facing. Our current budget and our staffing structure will not allow us to meet the demands and the challenges of the 21st century and beyond. And now's the time to move to improve and invest in public health in Southborough. No other government agency is as far-reaching and invisible as local public health. No matter where you are, work, school, play, home, local health departments are responsible for ensuring your safety and well-being. Local health departments are the boots on the ground. They're the beacon to identify and alert communities when there's a potential public health risk or a problem. And they use that information to defend against those risks that the community may face. And despite public health's typical low profile, the impact of health and safety on each and every resident in Southborough is clear in public health. In recent weeks and months, you've heard a lot about the work that we've been doing in the health department, and you probably heard a lot about contact tracing. This is when the nurses in our health department call a resident of Southborough that's been tested positive for COVID. During that investigative conversation, the nurse answers questions about COVID. They find out what close contacts that person had during their infectious or contagious period. They discuss topics like quarantine, isolation, protocols, policies. Sometimes they help families with resources that will allow them to adhere to the quarantine and the isolation timeline. We communicate with schools, with businesses to limit the spread. What you may not be aware of, however, is that contact tracing and case investigations is a core part of public health, and it's something we do all the time. You're just hearing more about it. There are many communicable diseases and infectious diseases that we track all the time. You just don't know about it because unless it impacts you and your family or someone you know, you wouldn't even know what's going on. But that investigative work is what protects the residents of Southborough from a spread of that contagious disease. It's important that you know also that as soon as the first case of COVID-19 was identified in Southborough, our staff leaned in and they took on the challenge. Early on, it was just as overwhelming for all of us as it was for you and your families. Emily Amico, who had just taken a part-time position as public health nurse, quickly ramped up, putting in hours that she never expected or was hired to do. She had to learn all about enforcing the myriad of orders that were enacted by the state around essential workers, essential businesses, social distancing, providing education and information to individuals, to schools, both private and public, and to businesses regarding the ever-changing quarantine and isolation protocols, collaborating with local hospitals, medical provider groups, group homes. We do have group homes in Southborough, private schools, emergency responders, school nurses, and of course, our own police and fire. As you know, this was only a small part of the work of the health department. During my discussions with people in town over the past year, I quickly realized that many people in town really have no idea what our health department does and what they're supposed to do. So I'd like to take a couple minutes to just talk about that. While the pandemic has taken much of the work that we do, it's only a small part of our responsibilities each and every day. In the packet that I sent you or that Kathy sent you, you have a list of public health, A to Z, all of the things that we in the health department need to know about. We may not encounter it every day, but when that happens, we darn well better know how to handle it. So it requires a breadth of knowledge and understanding to know how to deal with all of those. Another piece that I sent you was all of the mandates and the statutes. Some of them are outdated, but they're actual laws and statutes that we need to enforce. And while the pandemic has taken over much of our work, it's really just a small fraction. Our health department staff inspect restaurants, food trucks, public kitchens to ensure food safety and prevent outbreaks of foodborne illness. We inspect public pools, children's camps to ensure that our kids are safe when they go off to camp. We monitor water quality in public pools. We respond to reports of housing code violations to make sure our residents aren't impacted by dangerous housing conditions. We enforce tobacco regulations to keep our young people safe. And when I say tobacco regulations, we're talking about vaping, we're talking about medical marijuana, we're talking about all of those things that we get involved in. We ensure proper installation of septic systems to protect us from human and environmental health problems. We work to prevent and respond to any and all communicable diseases that protects the health of all. And these are only some of the things that we're responsible to do. We do these things because we want to protect all residents of Southborough. We're proud of the work we do. Our workforce is knowledgeable, passionate, and committed to the health and safety of all Southborough residents. What most people may not realize also is that this work requires a unique set of knowledge of the community, knowledge of its residents, knowledge of the current conditions, the current resources, as well as the most current state protocols and procedures in public health. And those are ever changing. The amount of work that a local health department is required to do today is far different than it was pre-9/11. It continues to be ongoing responsibilities put on local public health. If we're required to go back to status quo of pre-pandemic budget, staffing, and infrastructure, we all should be concerned. While most states in our country have county or regional public health systems, they have sustainable funding, consistent state and local funding. Massachusetts does not. Each municipality is solely responsible for the funding and staffing of its own local public health. The good news is, however, Massachusetts has recognized that, and they know that this type of structure of local public health creates tremendous variations across the Commonwealth, resulting in inconsistent and inequitable levels of service community to community. So in May of 2020, Governor Baker signed into law the State Action Plan for Public Health Excellence. This act is now called Chapter 72 of the Acts of 2020. And this is the first step in reaching equity and consistency of local public health across the Commonwealth. This act may potentially provide sustainable funding to support some of the work that our health department does. Within this act, there may be other opportunities for different kinds of funding. It may provide opportunities for cross-jurisdictional work between communities of like size and needs. It may also present opportunities for shared data collection, resource allocation. This work would allow us to get on track to meet the 10 essential public health services and towards state accreditation, which we're not even close to meeting at this point. It's important that we recognize that our state moving in this direction is the right direction, and it supports shared services, and we will absolutely monitor and investigate any opportunity to work together with other communities. It's more efficient, it could be more efficient, it could be more effective, but it's got to be in the best interest of Southborough. In order for us to do this, we must have core staff in place to do this. It takes a lot of work to investigate every opportunity to evaluate whether it's right for Southborough. We must have a full-time health director that's able to do this work. Examples of some of the shared services that are required are inspectional services, epidemiological services, which we don't have any right now, data collection and reporting services, technology and GIS services. Data drives public health. Data is what allows us to see how well we're doing and are we meeting our outcomes and where can we improve. And without the staff to review and monitor that data, we don't have an action plan. We can't have an action plan. It's very important to know that this act is not intended to be cost-cutting or to replace local public health. It's strictly a tool to move municipalities towards excellence in public health, and hopefully will provide each municipality with sustainable funding to move forward. We know there'll be another outbreak. And even if we don't know when that will be or how severe it will be, we know it will be. And we must be better prepared. We know now that we must do a better job at preventing the more ordinary threats that we face every day. In order to be prepared, we must have sustainable funding and adequate core staff to carry out the required responsibilities and expanded role of local public health. Eventually, we'll emerge from this critical phase of the pandemic, but that will not be the time to cut back and go back to status quo. This pandemic is going to leave us with many unintended public health outcomes, some of which we may not even realize at this point. There's post-COVID health issues still in discovery. There's mental health exacerbations and even new mental health issues related to isolation and depression. Our children, say no more. The impact of children being at home for so long with remote learning, the outcome is still unknown. We must be prepared to tackle these issues. I want to make clear, COVID is not going away. As many people say, it's going to be with us. It's going to look different, but it's going to be here. So there is no post-COVID staffing or funding. We may be looking at annual vaccines, similar to the way we have the flu. We may be looking at booster shots to extend immunity. We don't even know at this point what we're going to be dealing with after we're out of the critical phase. We may be expected to monitor individuals according to the vaccine that they received. Without core funding, how can we do this? Status quo is not okay. I know I've talked a lot about COVID and COVID impacts and outcomes, but it's important to know that the health department has been in overdrive in all the other things as well. We're mandated to respond to a complex set of responsibilities, including enforcement of state sanitary, environmental, housing, and health codes. As I talked about, the food supply, we monitor the food supply to make sure we're safe. We permit septic system. Every house, every business that is sold or bought in Southborough goes through the health department. Without staff, consistent staff on this, it could affect the economy of things being able to move, houses being able to be sold, businesses being able to be sold. We monitor landfills and other solid waste facilities. We are in discussions about our transfer station and licensing all of the haulers to try to gather better data about what's going on and how, the selectmen can decide what the best outcome is for our transfer station. The health department is in charge of doing that. We work with healthcare on disease control, timely reporting to make sure the communicable diseases. We worked on food poisoning, safety regulations, rabies, inspection of pools, camps, motels, enforcement of lead poisoning regulations, enforcement of non-smoking laws. Let's see, there's a wide range of data that's required on multiple of different data systems. That hopefully the state's going to work on that, because that challenge of reporting and recording and reporting data to the state in multiple different data systems is onerous and time consuming. We have to report housing code enforcement data, septic, Title V enforcement data, Title V inspector and soil evaluator certification data, lead inspection data, private well water protection data, food inspection data, data on compliance of food inspection qualification standards, statewide data on food safety violations. MAVEN is our data system that reports the communicable diseases, providing case management and data reporting across the state so that we can monitor any potential risk that might hit Southborough. Data on compliance with requirements to lead determinations and housing inspections. Data required from local health departments on the frequency of their water sampling. MMIS is our immunization reporting data. And now we have a new data system called PrepMod, which is going to replace or support MMIS, but it's another data system that we need to learn. There's always new data systems, software, and things that someone at the health department needs to know, needs to record, and need to report. I know it's going to take courage to report, to vote on this dramatic increase of the Board of Health budget. We all understand the competing demands on funding for the needs of Southborough. But I would challenge you to invest in local public health and vote to approve this budget. This budget is flat except for staffing. Nothing else has increased. The only increase you're seeing is on core staff, a full-time public health director, a full-time public health nurse, and a full-time business administrator. There are many other positions that are going to be needed and recommended, but those are some of the positions I think we can use through cross-jurisdictional sharing or some other community-based sharing that we can do. But these are the core staff that we need now and we need in the future. The state engaged this expert panel to give us basically a roadmap to improving public health in Southborough and every community. This template tells us what we should be doing and how we should be doing it. The template recommends that communities invest a minimum of $35 per capita in public health. Our proposed budget fits within that recommendation. The status quo is not okay for Southborough. I know we talked a lot about cross-jurisdictional or community partnerships, and I want Dr. Heather to speak a little bit about, I mean, she's been here a little over a month now. She's really jumped right in and she's trying to do the best she can with half time, and she can speak to that, how she's doing that. But she's also tried to reach out to other communities on how we may partner and how we may work together. And I think she'll support that. No community is going to want to work with us if we only have a half-time staff. It's got to be a win-win for both communities. So Heather, I don't know if you can speak a little bit to some of the work you've done to date and some of the communications you've had about a community sharing services.
Right. So I mean, kind of right coming in for my first month, I was looking to hire a new nurse. I've been working on it and we're not there. And the other thing, jumping in, trying to get COVID vaccine for our residents. And obviously that in and of itself is a full-time position just for me to take on. And as she said, I'm at 20 hours. I mean, I work all weekend. Anyway, it's more than a 20-hour position. What other towns are doing in terms of the COVID vaccine response, they have directors, they have nursing in place, they use per diems, they use staffing agencies, but the agencies won't give us anybody. Anyway, so they posted for vaccine coordinators and to hire above and beyond kind of the core staff. And the Massachusetts Department of Public Health is changing daily, let alone weekly, but in general, they're actually kind of moving back and not planning to do a lot of the vaccination through local board of health. So we'll see how this goes. But right now we did get approved. I did an application. I secured vaccine for our senior housing authority because it's a different pot. They're not sending it to in general to local boards of health. So I'm putting that together next week. I mean, that's just a lot just for me with no, I have a per diem nurses now, but Emily has resigned her full position. That's just a lot to do. We also, through the grace of God, really, because I don't have the bandwidth, especially without a nurse, to pull together vaccine applications for a regional approach. That's the only other thing the state is looking at is regional vaccination. So we were lucky to be invited to Hopkinton. We got a lot of our 75-year-olds vaccinated in those 5 days. And then Kristen Black in Northborough is leading, has applied again this week for local vaccine. We moved the 5 towns to now include 8 towns. And she's leading that charge, and I'm lucky she invited because I certainly can't lead that type of charge with the staffing I am at and others are at. So she had posted for a vaccine coordinator. So she has folks who can go into that role for some of the administrative work. So that's just in dealing with COVID right now with the staffing. So looking at, luckily we meet as health directors and health agents, we meet, these 8 towns or these 5 towns that are doing the vaccine together, applying for vaccine together. And we also have a standing weekly meeting for what's called Metro West, which is some other towns, Natick, Framingham. Those agents are not involved in our regional vaccine applications, but I am getting a good feel for the other health directors. I have a phone call tomorrow with someone. Obviously, I've spoken to Northborough a number of times. And from day one, I've been asking about the regionalization. And about 2 weeks ago, the state released that they're going to have letters of intent. They want, I think, filed in March and applications due in April for looking at regionalization for local public health departments. There's been examples of this across the state, and some are established. Worcester does one, I think it's 7 towns. Anyway, so when I go to our Metro West health agents meeting last week, I asked everyone, I said, who's interested? What do folks think about, applying for this money to kind of investigate, coming together in regionalization? And I hate to say it, they almost laughed at me. They almost said, the state's just doing that because it's a pandemic. I mean, we can't keep up with what we're doing now, let alone trying to spend hours trying to fill out application for this regionalization money to look into it. And I'm going to an info session March 1st about doing it. There was one health agent who at least will talk to me. I'm talking to her tomorrow. And one other agent was willing to talk to me off, separately. She's only interested in regionalization in terms of inspectional services. So it's never about the core staffing, sharing that. I mean, that's just not even on the table locally with now I'm about 10 towns that I've been in touch with. The others said they're not even gonna fill out the application because their current staffing is full out with COVID. So, it's interesting to me, because I come through my training a little bit more on the state level. Then, this is new for me to be in a town and a local. So obviously I do think, about how our state is different than other states. And so I'm going to go to the informational meeting, see about, I don't know exactly how you apply. Mary Lou, you probably know about how you apply for these to look into the regionalization. But from the conversations I've had with the other health directors, there's sort of shared services, sort of in some of the specialty thing, like the inspections can be very specialty and you don't do them very often. And, epidemiology or, data review services, although I personally feel fairly comfortable with that, but, like some of the specialty services, but it's not about the nursing or the public health director. That I have sort of come across, but like I said, it sort of interests me, the concept of regionalization. I did do work with Worcester, through my other job through Worcester Department of Health. So I've been with them, I've done a lot of stuff, different projects with them. So they had set that up years ago. I think it's 7 towns. I think some of the other towns feel a little bit left out, like the money comes through Worcester and, the other towns kind of don't get a fair shake. But I don't know. I mean, I think, we do have a group of towns near us. It's a little complicated, like our emergency preparedness region, like we're in Worcester County. I don't know, Northborough's in a different emergency preparedness region than the region we're in. I have this other group with the Metro West, which goes out to Natick, Wayland, Sudbury. It's a different group than, I don't know, I'm still working on that, but it's a little odd to see exactly how we regionalize based on kind of the different groups that we fall into by county, by emergency preparedness region. Obviously Northborough, we're tightly tied in through schools and housing authority. We're working, they have their housing authority vaccine next week too. So anything else, Mary Lou?
No, I mean,
I'm still learning. It's just,
yeah. And as Heather sort of alluded to a little bit, and the regionalization piece, DPH has tried to regionalize many times in the,
There's certain
mean,
areas,
some are-
right? The Western State, and then there's one up in Neshoba, apparently that's established.
yeah, but
and,
it's the 30-something
the
years that I've been in public health, they've been trying to do regionalization. This blueprint is different than any other attempt. The DPH knows that community partnerships and regionalization has to be born within, where our home rule public health in Mass, each municipality wants to have some control of what they need and their needs are. And so you might have a regional shared service for one thing with one group of towns, and you might have shared service with another group of towns. And so it's going to take some work and some, just evaluating what will work best for Southborough. I mean, right now our inspectional services are contracted services. I think we're lucky because some towns aren't that, but some towns don't have the volume of septic that we have. So our inspector now primarily works 3 days a week, but he is on contract, and approximately 90% of the funds that come in to support that budget line goes back to the general fund. And so that's a revenue producing opportunity. We also been forward thinking in that we have a revolving fund. This allows us to buy the vaccine. Many towns don't even have a revolving fund. So when it comes time to buy the vaccine, even though you might get reimbursed through insurance, you have to buy it up front. We have a revolving fund. So we've set the core of what we need to move forward, except the staff. We need full-time staff. I mean, would we even think about having a part-time police chief or a part-time fire chief? I think what we don't realize is public health is that third leg of public safety in Southborough. And I don't think our residents have looked at it this way in the past. And as I said to you, public health is invisible until there's a problem. We have to have all of the systems and policies in place so that when that happens, we're prepared for it. We clearly were not prepared for this one, nor many municipalities, so we're not alone there. But it should be a wake-up call for us to be prepared going forward.
All right, so thank you for that for both of you. So let's now, let's get one thing clarified, and let's go around the room and ask questions with the remaining time that we have. So Mary Lou, I've got the proposed budget pulled up for fiscal year 22. And your statement earlier that everything else is flat is not correct. Every single line item is up, and some up a lot. There's not one that's not up. So other than salaries, the other piece of your budget, which is about 84,000 is what's being requested, 57,000 for the current year, it's up 45%. So can we just run through that again real quick? I know the 10,000 is a new copy machine, right?
It is. We currently do not have a dedicated copy printer scanner, which we need for HIPAA compliance on many issues. And I don't know, Barbara had done some research. There may be some wiggle room there. I don't know if the town leases machines or buys machines. I don't know the ins and outs of that, but the copier scanner commercial to do what we needed to do, I think she priced out in the thing anywhere between 8,000 and 12,000. So we just put 10,000 in the budget.
All right, so that's about what it takes for a machine like this. So I agree with that. So now let's go down to the other number that's jumped a lot. So the contracted services, 52 to 64. Your note on the budget, it sounds like you're adding more hours there. You want to add $12,000 for a per diem health agent.
Well, yeah, it's that, right now, our contracted inspectional services, Dennis Costello, he has 2 jobs. He's a health director in Boylston, so he can only work Wednesday through Friday. There are some times when there are inspections that need to get done on a Monday or Tuesday for different reasons. It may be an emergency or not. And so although the contracted services has gone up, like I said, 90% of that money comes back to the general fund.
Right. There's the fees associated with those that return.
No, we understand that. We see that it's in local revenue, so we get that piece of it. Okay, I just wanted to clarify that every single line item is up. So you may need to go back and scrub some of the smaller ones just to try to get something out of this, to try to be able to get what you really want, which is a salary line going up. Okay, so I'm going to stop talking and I'm just going to go around the room in the order I see people. So I'm going to start with Andrew D.
I don't have any questions right now.
Okay. Andrew P.
Heather, Mary Lou, thank you for coming. Thank you for all you do also. The only part that I think I saw, obviously looked through all the stuff you sent, but I know they're adding a lot of new things, for COVID and that kind of thing, but what incremental services will these other resources do? I don't want to say post-COVID because COVID will always be there, but like you sent a list of all the statutes and mandates. Are there anything on there that we're not doing that this will allow us to do? If you could just explain that, I think that's the big thing I'm looking for.
Yeah, there's lots of things we're not doing. Public health is about, as I talked about, is about reviewing data, understanding your community, understanding what we're doing, what we're not doing, analyzing that data, and then putting a plan in place to prevent risks and problems going forward. We do not have the ability to do that right now. We don't have any staff that can do that. Heather has just come on and she is pretty good at data and pulling data. We just we just brought on an intern at no pay to try to help us with some of this data collection and reporting. But we're not doing any of that now. Some of the data reporting that's required by the state, we're not doing because we just don't have the staff or the manpower to do it. Our inspectional services, like I said, they're only Wednesday through Friday, and we're trying to work within that and trying to help. But sometimes, a house is going to close and someone needs to get out there on a Monday or a Tuesday, when they were doing their septic installation, they came across a problem and so they couldn't finish, so they have an open hole and they got to put a fence around it. Someone's got to go out there and check that it's safe to do that. And if no one's out there to do that on a Monday or Tuesday, it puts the town at risk for someone falling in that hole or something happening. So having inspectional services available 5 days a week is important to do that. I'm trying to think, Heather, what are some of the other things that were?
Well, I mean, I guess I'm just not up to date on what all the inspectional requirements are. I mean, but we're definitely not meeting all the, I sense, food establishment. I remember hockey rink. There is one at a private school. I think Paul was saying we had to turn that over to the state because we just didn't have the resources to do that. Other inspections, there are a couple pools, I think you said, at the private schools. Again,
the schools,
don't have
we're doing the private
resources to
schools.
do-
We haven't done so much with that. We should be doing more with that.
Yeah,
with
there's
the
more
private
inspections that we're not doing in
Day
terms of,
School, St. Mark's, NECC. We should be working more closely with all three of them.
Mhm. I think we haven't even tapped into really prevention and education. What about like vector-borne diseases? I mean, what about, the Lyme disease is rampant. I mean, they haven't.
I think my concern is a little bit less of what we should be doing and what we are mandatory. Like, are we in trouble?
Stuff.
Are we in violation? Are we going to get fined by the state, by the federal government because we're not doing something? Or are we checking all the boxes at a minimum, and then this would incrementally allow us to do some of those other things?
Right.
That's what I'm trying to get to.
Some of the things are minimum. We're trying to do that, so we don't, leave ourselves open for any issues. Like the issue that I talked about happened a week ago with the septic issue. They ran into problems. Paul was able to get out there, but honestly, if someone wasn't able to get out there, we opened the town to tremendous risk by not doing that and getting out there.
Would we have that same risk over the weekend though? If we didn't, do we need 7 days of inspectional services?
No.
Yeah, but they know that they can't get inspectors, so they're not approved to do. They were approved to start their septic, but they ran into a problem. The inspector was supposed to go out on Wednesday to review, but something happened on Tuesday and that created that hole. And so we didn't have anyone to go out. So, you know, we made it work so we could be out there. So to your point, we're doing the bare minimum. We probably could be in trouble with the state for some things, but they're in no capacity to
The
do
state
that right
can't.
now.
Yeah, no,
Exactly.
no.
They're overstretched and I
That's
don't
the only
think they're gonna.
benefit to us not getting fined or not getting reprimanded for some of the things we're not doing is just.
And what
'cause they
about,
don't have
right, the
capacity.
trash haulers we need to do, but we haven't done, but I don't know that the state's gonna come after us.
Right.
Yeah, I mean, that's a
And-
local ask. That's not a mandate.
Oh, we have
Right,
mandates.
that's not a mandate, right,
No, but
right.
we are mandated to monitor the solid waste disposal, all of that. That falls under public health. It hasn't always. Same as animal control. I don't know the history of animal control or why it went over to the selectmen overseeing that. That's supposed to be overseen by the health
Yeah.
department. And there's clear data that's supposed to be collected and reported, and it's not being done. So, I mean, I'm discovering some of the things that aren't even being done now, just in the course of all of this work that I've been doing over the last 6 months.
Yeah, I think, especially as we get closer to town meeting, I think having something like that that says these are mandate statutes that we're not quite doing and that this would allow us to do the minimum that we're supposed to require to do. And then on top of that, this is the incremental, benefit to the town of having more resources to do some of the other things. I think that would be the real message that would be easiest to sell to the town.
Okay.
Other than that, I'm good.
Jason?
I have a bunch of questions, so I'm happy to go at the end. Or if you
Why
want
don't
me
you
to-
go ahead? 'Cause maybe you'll
Okay.
knock it out for everybody else.
So, on the copy machine, if we had an IT director, I would send you to him or her. Mr. LaFlame, when he was here, when we had to outfit the entire public safety building, there are multiple machines in that building. None of them cost anywhere close to 10,000. I think they're higher volume type machines. So I do think there are options there. I wish he was still here to provide you that advice because he really did a phenomenal job of walking through what's the right, what type of machines you need. And, with all due respect to both of you, obviously I didn't expect you to be experts in copy machines. So, or Barbara for that matter. So if there's support we can provide there, because I think we all have a common interest of getting that number down. I would also ask you to think about whether if you do need a machine that size and one already exists in the building, is there a way to put like a key card access, like an ID badge that you swipe? Most of us that work in firms that require privacy, along the lines of HIPAA, you have to scan your ID badge to actually get the printout. So, I know you share with building department, for example. So if the building inspector went over the machine, she wouldn't be able to get your HIPAA documents if you had that. That can't cost $10,000. That's just suggestions for you to
And
think
what about, I mean, HIPAA, there's some e-faxing apparently, but I don't know if the town does that.
I don't know either.
Yeah, I think to Jason's point, I mean, we're open to whatever works best. We share with the building department now, like when we have to do septic plans and all of that, because they have the ability to scan a larger piece. So sharing those services is no problem at all. But having a dedicated machine in the health office is just critical. It doesn't, I don't know the dollars and cents. And we're open to working with whatever works best. I don't know if the town leases machines. That might be a better option. I don't know.
Well, I'm
So I'll
smiling
I'll
because
jump
we're
in.
talking about that. So, whatever. We can deal with that. We just need to know more exactly what that machine is to do, and that way it can be sized. $10,000 buys you the full big old scanner. So I've got two in my office, and they did cost $10,000. It does everything that you can possibly want to do. If you just need one to do certain jobs, you probably could do one smaller. But let's not spend too much time on this one. This one, I think we.
that was hopefully my easy question.
Yeah.
So then I guess my other question, Mary Lou, I don't know how many years you've been on the planning, the Board of Health, but I know it at least dates back to the public safety building when we're going through some of the initial permitting. Has the Board of Health ever brought a proposal like this forward that wasn't supported? I mean, like, I know you bring your budget, but I guess I'm trying to understand why it's this year and why it wasn't like phased over time. Like, other than the obvious of what we've all dealt with over the past year, like even last year, like by the time we got to town meeting, we knew enough of what we were all in the middle of. Do you just have any perspective on that?
Yeah, and I've rethought that much. Because with the public health background that I have, sometimes I've sought back, say, how did I just sit back and let this just go on the way it has with a part-time director and part-time, honestly, my personal work was just crazy over the top, and and maybe I should have taken a stronger stance earlier. But no, we haven't been before town meeting for an increase in budget for, I think the last time was when Paul was a full-time public health agent. And that was many years ago. And our budget has pretty much, remained, when whoever said, you need to cut 1%, you need to cut 2%, 3%, it really just fell on Paul would just cut it out and say, this is what we need to do. This is what we're told. And I should have taken a stronger stance. I realize that now. But the pandemic is what basically just highlighted all of the inadequacies. And Paul, as good as he was in environmental and sanitary, when COVID hit, he just like couldn't even try to tackle COVID. Like, that's not my thing. Like, that's not what I do. I'm not in the health side, and put everything on Emily. And that's when the board realized, oh my God, we got to step in here, because this is just not working. And of course, everybody thought it was a few months or 6 months, and okay, you get by, and and it's just, I put that part on me, Jason, because I've been on the board for, I think this is my 3rd term, and I probably should have dug my heels in earlier, but I just can't sit back anymore and let us be really just so underfunded and understaffed to support the residents. I just can't do it anymore.
I just want to make sure that no one has said no before, right? And it doesn't sound like that was the case. And so I guess, Kathy, I'm not sure if this is a question for Mary Lou and Heather, but more broadly, obviously their budget, which ultimately they'll own regardless of whether we support it or not, includes 2 full-time positions that we didn't have in this year's budget. Do we know, let's just say that gets the support of town meeting. I think we need to be very crystal clear with Mark and Brian probably about that benefits budget, right? And whether that currently is carrying potential for 2 FTEs or not. And let's just say town meeting supports it or doesn't support it. Does that move or does it not? Because I know that sometimes has cushion in it too, because you never know people coming in and out of plans during a year for, reasons outside of just adding new people. So I think it's more just of a to-do that before I can vote, I need to understand how that all factors in.
Yeah, I did talk to Mark about that, and he seemed that it was doable. That's all I know.
Mary Lou, let me answer this one because I know the answer. So Jason, right now, he's built into the budget for next year 20 new full-time people on medical insurance. He doesn't know who they are because people come and go during the year. So he's not trying to nail it to these. So he's got 20. He had a lot of cushion in the year we just ended, fiscal year 20. He's going to spend, he thinks, at least 98.5% of fiscal year 21 based on what he knows right now. So it just depends. So he does, it's not so exact that he's got every single person nailed, but he adds a number of people that he thinks will come and go. So he's got 20 in there for fiscal year 22. So that's why he's saying to Mary Lou that he thinks they've got it covered. But it's not 2 positions. Let's make this clear. It's 3 new ones. I
don't think it's for benefits. But
You're right.
Barbara-
It's 2 for benefits because Barbara's already full-time, but so Jason, I'm coming back to you. I promise you, I'm not cutting you off here. But just to be clear, is Barbara grade 5 right now?
She's not. That would be an upgrade for her. And I sent you the business admin 2, which is what fits. I talked to personnel board. As long as she's going to be doing the work of a job description that's already approved, and that's the work she's going to be doing. It's just a promotion to that.
Okay, so she's 4 right now.
She is, and she's doing a lot of the work of a 5 without being paid for that. And so realizing that that's going to be, not till July 1, but that's
We're
the
just,
plan.
we're just trying to make sure we got the facts, right? So we can
Right,
make a good
right.
decision. Okay, Jason, back to you.
I it looked like Andrew was trying to weigh in,
Yeah.
so.
I just have a question about what you just said, Kathy, about, I think you were saying, so Mark Purple is saying that the benefits number that he has in the budget assumes that there's 20 new people coming on the town's health insurance plan.
That's what, so Mary Lou's talked to Mark. I've
That
talked to
sounds
Brian.
like a very high number. And
It did to me too. That's why I ask about it, because if you're not hiring any new people, why would you assume that?
is it dependents or spouses? And
It could be things like, you've got a person, it could be people coming on the insurance that were on their spouses. So there's probably a variety of permutations that could do that, even if you're not adding new people. Here we are, we're really adding, we're going, we're putting 2 new people on full-time benefits. So here's 2, right? But as far as we know, we're not adding any new people anyplace. So I was surprised. I asked about it. He said, you got to put the cushion in because people come and go. And it could be what you said, someone's spouse, they were on their spouse and now they need to be on our insurance.
Kathy, and retirees.
Yeah.
Because they'll
So-
fall off and somebody else will be added on.
okay, I still don't completely understand that, but I just wanted to, about how there could be 20 new people coming.
Well, I agree. I think there is some surplus in there, Andrew, because they just try to be conservative. So they have not identified 20 people. They just put 20 in there to catch what comes in. And so that, if you remember last year when we did the reserve fund transfers and the between account transfers, the between account transfers came out of that budget. So that's where they took them out of, because there was extra money in the benefits budget. Brian said this year, he thinks that they're going to spend 98.5% of it. So they won't have that surplus for fiscal year 21. So it sounds like it's a year-to-year thing. And I looked, they actually had 20 new ones in there for last year too. So I don't see it either if you're not adding new people other than these 2, where it's coming from. But we'll discuss that later. We're going to run out of time with
Okay.
Okay, so back to Jason.
So then a question on the mental health aspects of what the pandemic has done. I obviously completely understand, there's varying degrees, obviously, across everyone, right? All age groups, right? From our youngest to our oldest citizens. I guess, where do you see your functions starting and stopping as compared to those of youth and family services and council on aging? Because we candidly heard the same thing from both of those groups.
So this is another reason, and Heather, you jump in, but this is another reason why we need a health director. And someone of Heather's caliber, being an MD and an MPH, it's collaborating with youth and family services, who covers the younger ages. It's the council on ages, who covers the older ages. And we have a big gap in between. Who's covering those? So it's the health department working with those 2 agencies, as well as maybe other agencies, to try to provide support for residents in a wide range of ways. Some of it may be through grant funding. Some of it may be with collaborative funding. I don't know, but that's why we need someone to do that. Mental health is a part of public health.
Yeah, and schools too. I mean, my very first couple weeks, I spoke with Sarah Cassell briefly, and right, mental health is big on her agenda, but also is, teens and the new screen addiction. And also I'm hearing from the medical colleagues with the school, the MAT, a medical advisory team with the schools. I mean, the mental health of our youth who are not in school is really terrible. And psych, younger and younger kids at 9 are with suicidal thoughts, and they can't get a psych bed in Massachusetts, and they're spending 2 weeks in the ER. This is what I'm hearing at my Northborough Southborough meeting. So, I feel obligated as a community to try to work with the school and provide more outreach to our residents around mental health availability of services and, facilitate, right now I'm trying to facilitate them getting a COVID vaccine, but I think we do need to facilitate mental health care because the psych hospitals can't handle what's coming in now.
All right, one more question and then a comment to close. I guess the question is on the environmental side, my understanding is, right, based on Mary Lou, your statement you just made, Paul was spending whatever the number of hours he was contracted for, pretty much tag teaming with Dennis, right, on a lot, right? They had my understanding, please correct me if I'm wrong, is they have very similar skill sets, right, in backgrounds, right? So, Paul may show up at my house to do a septic inspection, or Paul may show up if, they all have the same licenses. So with your plan, are we potentially jeopardizing and pivoting too much towards the other public health things that maybe we've neglected, not funded the right way, et cetera, and leaving kind of one side, maybe more exposed and was maybe over-covered in the past?
No, not at all. No, the inspectional services are critical. That's part of the core. Absolutely. Right now, I don't feel that we're covered for our inspectional services because Mondays and Tuesdays are pretty much not covered. So I don't see us swinging the pendulum to doing public health work and the preventative stuff and all of that.
But that's why you put the more inspectional
services
services in the budget to cover for Monday and Tuesday so that we do have 5-day coverage, which wouldn't be less than we currently have.
And if Dennis can't do those 2 days, we contract with someone to cover those 2 days.
Okay. All right. So you're basically backfilling Paul through the contracted services line, essentially. Okay.
Mm-hmm.
So I guess my parting comment, and this is not going to surprise you, is I continue to be a huge fan of the regional approach, especially given the number of specialties that you have outlined. And I realize you're an elected board. You have the ability to kind of make your own decisions, to the extent of funding, of course. I would strongly encourage you to continue to work with our town administration, other elected boards to see if we can't find partners, because oftentimes what I have seen in my experience through regionalization, sometimes just Heather talking to her peers, it doesn't, but it's maybe town manager or town administrator A has the same budget issue that Mr. Purple has right now, right? In terms of how do we, combine resources, right? And the reason I continue to push this is I understand the frustration and the struggles you're having hiring the full-time nurse, but maybe we don't need to hire a full-time nurse. Maybe we need to increase the hours of someone that's on someone else's payroll and supplement that with our budget, or vice versa. The nurse may not be the right example, but I do think that there is some push and pull there that you need to be open to, because looking at the percentage increase that this budget is, regardless of what we're in the middle of, is just going to be a tough sell, when you start, looking at what that would cost the average taxpayer. And I'm very confident that, that while the state, we may or may not agree with the state's vaccine distribution, and I applaud you for continuing to try. The state has not left us holding the financial bag with any of this, right? This town has not spent $1 more right now between federal funding and state funding.
Right.
So I'm hopeful that their money is where their mouth is with this regionalization collaborative and stuff. And I would strongly encourage you to continue to pursue those opportunities with this March cycle. And the worst thing that someone can say is, no, you're not a candidate, or no, you don't have the right plan. But if we don't try, we're never going to know.
Well, I think, Jason, regionalization and cross-jurisdictional partnerships is critical for us even having a full-service health department. Right now, with the core staff we're asking for is not a full-service health department. It's just getting us sort of to bare bones to be able to work on these regionalizations. We absolutely need when we first started this conversation, we all felt we needed 1.5 public health nurse to do what needs to get done. And we really chiseled, we really talked, oh, do we really need that? Can we do less? Can we just, and that's how we came to the 1 full-time, because we have 2, potentially 3 per diem nurses that can fill in the gaps when we need them, and we're not paying for them if we don't need them. So that was our way to think, how can we do this cost effectively and get done what needs to get done? But we absolutely need a full-time health director, and we absolutely need a full-time nurse, and we absolutely need a full-time administrator. Though that's and working on partnerships to do the other things that we need to get done, we're all for it. If there's ways to do it, but sharing with another community, so it's not coming out of our pocket, or if it's charging fees for things, we're open to that. But I'm talking about bare bones, and I know it's hard to swallow and it's hard to think about, but in order for us to work with other communities, we have to have that core staff.
Okay, let's keep going. We're going around time. We actually are out of time. Mr. Mooney?
Yes. So Mary Lou and Heather, first of all, I'm having a problem with my camera. It's prompting me to log off and start again, but so I apologize for you not being able to see me. Hopefully you can hear me.
Yep.
First of all, thank you both, Mary Lou, in terms of your passion, your commitment, Heather, to the residents of Southborough. Mary Lou, you mentioned perhaps your qualifications based upon perhaps a feeling that there may be members on this board that question your qualifications. I don't think that's it at all. And so I don't think you need to justify your position by supporting your qualifications. And one thing I'm struggling with, not so much struggling, but trying to understand, it really relates to Jason's question. And that is how much of this increase, or what percentage of this increase, is COVID related, as opposed to, perhaps deficits in the past that were just not captured on budgets. That's what I'm trying to understand. I don't know if you can quantify it in any way. If you could, it would be helpful for me. And then I have a second question, but I'll pause to see if you can answer that first one.
So I think that the increase is COVID related, but it's not, as I said, COVID's not going away. There's going to be other things that we need to do additional on our plate that's related to COVID, or maybe other variations or other mutations that we're going to have to deal with going forward. So that increase in making sure we have a full-time staff to be able to manage that, stay on top of that, meet with, the state has multiple webinars, as some of you probably know, to just stay up to date. The rules and the guidance is changing. It's because it's a new virus and we don't totally understand it. If you think back to the influenza epidemic, I mean, it really wasn't a lot different then. But then we went through a period of time where things just sort of chugged along status quo, and we just, we didn't do the data collection. We didn't do the analysis. If you remember back with Triple E and the impact that it had on all of our kids' sports programs and all of that. Code Red, we don't use to the degree we should be using. I just asked if Dr. Heather could be on the Code Red team. To me, we should be pushing out information to our residents through the Code Red system about COVID. We're not doing that.
Yeah, Mary, I was just, like I said, I was trying to understand, not so much about the emerging issues as a result of COVID, but just trying to understand. We obviously were able to operate the Board of Health in years past, and the Board of Health and its members were comfortable with the funding from town meeting. And clearly there's a part of this request here that addresses deficits that are already existing. And I was just trying to get a handle on if there's a way to identify COVID-related expenses versus, existing deficits. And if there's not, that's okay. My second question relates to, it appears that the salary line item is the driving force here. Is there a way to, and again, this may be something that Jason was hinting at, is there a way in which we could present a unified at town meeting, not having 3 new full-time employees, but perhaps assigning a part-time status to that or to those individuals such that the increase is not so significant? And then, of course, we keep our eye on it next year when we have the discussion again. That's just something, Mary Lou and Heather, I don't know if you've thought about that, thought about there being a way to achieve the objectives that you talked about in such a way that it does not require this year 3 full-time employees.
Well, right now we have 3 half-time employees, right? We're bumping those up to full-time because half-time isn't cutting it. We can't do it at halftime. And to Jason's point, to just collaborate with another town to maybe fill those voids, it's not there. Those opportunities aren't there right now. I do feel strongly that we're going to get some sustainable funding for municipalities for public health. I don't know when it's going to happen, but all municipalities are facing the same issue. And I think in the state budget, we're going to see some money that's going to be sustainable local health money. But I don't know when that's going to happen. And so to say, well, we can just use a part-time person for now in hopes that that money will come through, then we're back to status quo. Is status quo okay with the residents? Is status quo okay with you guys? I mean, not doing what we need to do and just chugging along, you could do that. I mean, the same way you could operate with a volunteer fire department and you could get by with that. Is that what we want?
Yeah, I don't want you to think or infer from my questions that I am making an effort to supplant your knowledge on public health and evaluating whether or not there's a real need. You've identified a real need, and I'm not questioning that. I'm just questioning it. Is there a way to take this, not so much in baby steps, but you know, a step at a time without the need to bring on 3 new full-time employees? And if the answer is no, Mary Lou, the answer is no. But I'm just trying to think of a way that it can be presented at town meeting such that, you know what, there's a way to get this done, but not all in one fell swoop. And again, Mary Lou, if it can't be done, that's fine. That's an answer. That's fine.
Yeah, and I hear you, John, and I feel like we really tried to sharpen our pencil. We really tried to, and thinking about what are the core services, what is the core staff we need? Like I said, you know, we should have a data person, we should have a GIS person, we should have an epidemiologist. There are other things that we should have, but we realize that's not realistic at this point, and we can try to fill in the gaps on those things. But as far as the core staff of a full-time health director and a full-time nurse and a full-time admin is bare bones as far as the board is concerned.
Okay, I appreciate that. I appreciate your efforts, really do. Thank you. Kathy, I'm gonna leave the meeting, see if I can fix my camera, and then Jason will have to drag me back into the room.
All right, he'll watch for you. Thank you. Judy? Judy? You got to unmute. Okay, while you're doing that, I'm going to.
I got it.
Okay.
I just wanted to say thank you for the presentation. I thought it was really powerful. And I hear you. So I may be the only one, but you're speaking to me and I support your request. That's it.
Well, that's cut and dry. Tim?
Can you hear me?
I can.
Hey, I'm not going to take too much time. As you know, Kathy, as concerned as I am about our IT department from a security perspective, I'm almost more concerned from a HIPAA compliance perspective. I don't think that the printer and copiers are areas where we should be nickel and diming to save a buck. There are too many technical requirements on their devices, their endpoints. It's too important Every violation has a potential fine of up to $50,000. And those violations can stack up really fast. When you have an unsecured printer that has who knows how many copies of documents that contains who knows how much PHI on it. And a large part of the
What is
fining,
PHI?
personal health
and
information.
Information.
Sorry.
So a large part of the finding process at HIPAA is based not just on the severity of the event, but upon how easily it could have been averted, and how much was known. Right? Did we know that there were holes in our network, in our copy machine, and we ignored it because we wanted to save $5,000? Well, that'll come back to haunt us if there's a breach. Okay. With respect to comments that were made before, our previous IT department did not have the compliance knowledge that was needed to effectively support the Department of Health. Okay, I'm just going to make it's my opinion. I'm just going to make that blanket statement. And I think it's going to be an important part of the conversation for the IT department moving forward. I just wanted to reiterate, talking about how much they're spending on their endpoints, their phones, their laptops, the software that they need to encrypt their hard drives, buying a new copier that's physically segregated as well as segregated in the network. These are no-brainers. That's the only thing I wanted to say.
Okay. All right. So let me just ask a couple questions. So Mary Lou and Heather, if you know, I know you said we don't do a lot for St. Mark's, Fay, and NECC, but do we do anything with them?
A little bit, yeah. We communicate with the nurse there, specifically around outbreaks, TB. I mean, you realize that St. Mark's and Fay School have a lot of international students. So there's a lot of conversation related to communicable disease that we do on a regular basis, but we haven't done more than that. Heather, you wanted to say something?
Yeah, like I said, I'm new, so I don't know too much, but I know we were supposed to inspect the pools. We may be behind on that.
All right. I didn't need details. I just want to see. Okay. Second one is all the towns around us. Do you know of anyone that doesn't have a full-time director and or a full-time nurse? Are we the only town that has part-time positions in both of those that we know of, or is that not true?
The towns that are like size and population all have full-time health directors and a full-time nurse. Some have more than that.
Okay. But they at least have the full-time in each one of those.
Correct.
Right. It's hard for me to figure out the nurse because I talked to towns and they have seemingly a lot of nurses, but I think it's not, some of them are per diem. I don't know exactly.
Some of them contract their nursing services.
See, that's what I mean. A lot of them have this VNA. Northborough has VNA
with VNA
contracted nurses. So I don't understand how that works, but I sense there's
All right, but your sense is
one
everybody
equivalent.
like size does have a full-time director and seems to have a full-time nurse in some form or fashion.
They definitely have a full-time nurse or like you said, the equivalent to a first-time nurse if they've contracted with VNA services. And we looked into contracting with VNA services and it was going to be far more expensive. And that nurse wasn't unique to the town. In other words, they're doing many other things. So they're not really looking out. They're just doing the work that the town asked them to do related to a flu clinic or a vaccine clinic or whatever it is.
Okay, last question is.
Williston doesn't, but they're smaller.
Right.
Okay, last question is, I have heard that you're having trouble hiring the full-time nurse.
We do. We had two awesome candidates. One was the president of Public Health Nurse Association, but the fact that there was no guarantee of funding past December was a problem for her.
So that is the issue. That's what I'm trying.
Yep.
All right, ladies, thank you so much. I know how much work you're doing to try to get this budget passed. So it's truly, truly appreciated. We're not voting tonight, but we will take a position in the next couple of weeks, and I'll let you know if there's any further questions that we can get answered real quick, and let you know where things come out. Okay.
Okay, thanks. I appreciate.
Thank you, Heather, so much for doing this.
We
tonight.
are, we are planning to go report out at town meeting and defend the budget if we need to
You
go that.
you certainly got the right to do it, so that should, that can definitely be your plan if the recommendation from advisory and or board of selectmen is to not support the full thing or support some of it, but not all of it, which could happen too. Then you certainly have the right to go to the town and say, we disagree and this is why.
Kathy, one question I had while Mary Lou and Heather are here that's pretty quick is, if we did a 1/1/22 start date and approved that at town meeting and kept it as a contractor through December so we could get the CARES Act, would that be an issue? So it would be approved. So as you get people, they would know that in January, they'd still have a job. It's just by not approving it as a 7/1 start date, we could still get CARES funding.
I believe when I checked with Carla, that wouldn't, even if we bring someone on in July, so the budget's approved, we bring someone on in July, we can still get CARES Act funding because it's a new position that just came in this year. So the halftime has potential for CARES Act funding, but we can look more into that as long as the person has some confidence that they are going to, be funded through the year. I mean, every contracted position is dependent on funding, but let's face it, town meeting they have to approve, the funding for every position.
So that's one thing we're thinking about, Mary Lou and Heather, as far as a way to do this and still cut down some of the money expended by the town. So we will keep you posted.
Okay.
But again, thank you very much. And we will talk to you soon.
Thank you.
Okay, thanks.
Okay, so Jason, I see one,
Thank
two.
you, Heather.
Yeah, do you want to, Mr. Lit has his hand up. Do you want to either bring him in or you want to save that for public comment at the end?
I wish I knew if you want to talk about this or MTC. We're running behind, so let's not do that yet. Let's see, we'll save him for public comment.
All right, so I'm going to move MTC in.
Yeah. So Tim, why they're coming in, just to be clear, the reason we were talking, what I said about it is because Mary Lou had said that the rest of the budget was flat. The rest of the budget is nowhere near flat. So I just wanted to make sure that was clear, that they were asking for a increase in every single line item.
Yeah, and especially when they are increasing their technical budgets, that really, I mean, there's an argument to be made that that shouldn't even be in their budget. It should be in the MIS budget.
Well, I pulled up the MIS budget. We met with Tom before, right before he left, right? He had a budget put together. I was sitting here looking at to see if there's anything in that. He's got quite a bit of money in equipment, which is not the servers we're about to talk about. It's something else. And I forget what's in it, but there's money for equipment and there's $26,000 there. So I don't know what he intended there. So we definitely should go back and figure that out. Maybe what she's asking for can come out of that, so we can push it over to that. Okay. Let's keep going. We've got a new group here. Okay, so there's Matt. Hi, Matt. Why does is Larry Sandberg a joke, I guess? No, there he is. Okay.
There he is.
All right. So who am I mixing him up with? That's also, never mind. I know who it is. Okay. All right. Angela and Will.
Yes.
Okay. So welcome to advisory. We are glad to see you guys and are looking forward to talking with you tonight. So I talked to Matt last night just to kind of give him some background as to what I thought, where this conversation would go, just to give him a heads up. But by way of a little background before you guys take over, last year advisory pre-pandemic was very concerned about the structure of our IT department, which was basically one person. And so if you go back a little minutes, you're going to see where we were very concerned that if something happened to Tom LaFlamme, he quit, he got sick, whatever, we got a problem. And of course, guess what? That's exactly what happened. He did. So we were actually pushing for a second full-time person last year. It didn't get, we ended up not doing that, but we really felt that that's what we should do. We felt strongly, we actually put it in the advisory report, then went to town meeting, et cetera. We ended up hiring, as you know, a part-time person, or approving a part-time person that, to my understanding, is still working. He's got a full-time job, and then he does what he could do for us at night. So we really, what we thought might happen has happened. So let me just say that. So we definitely want to talk about the structure as far as what you guys think we should have as far as staffing goes. Obviously, we want to talk about the equipment you think we need. And then we definitely want to talk about going to the cloud, and then anything else that you guys want us to know with your big brains.
Sounds
Hey,
great.
Matt, before you start, are those any of those first editions behind you? That's an
Of course,
impressive setting.
they're all original, of course, yes.
Wow.
So yeah, thanks for having us, inviting us to this discussion. And also thanks for your support in some of these initiatives. You have mutual concerns that we have had. And I think that, together, obviously, we can hopefully work through some of these things. So to start off with the first discussion of IT staffing, I don't think we're fully ready in terms of prepared to, have an analysis done of what staffing should be like. But I think it's pretty evident that the staffing should be more than one for redundancy, if anything else, right? Before Tom left, he did do a survey of some local towns near us, and to basically identify what current staffing levels they have for technology department specifically, and identified which ones are covering just the town, not the schools, and predominantly that was the same model that Southborough has. It's covering town technology, not school technology. In fact, there's one town, I believe, that also even excluded a library. The library apparently had its own technical staff. He also pulled basically how many endpoints they have, how many desktops, printers, etc. So I just, basically out of interest, just for fun, I put that on a graph. And if you wouldn't mind granting me screen sharing, I'd be happy to share what that graph looks like. I need screen sharing permission to do that.
1 second.
Okay. Yes. So basically, I mapped out the number of full-time IT staff in the town, ratio of IT staff per 10,000 residents, and for a few towns near us. Now, obviously, some towns have a lot more residents. I think we are, by and large, probably the smallest of the towns. But of course, our ratio then is the smallest. To move up to 2 staff would definitely bump us up in the list. It would put us closer to Hopkinton and Littleton. But this is just says even if we were to double the number of staff, we wouldn't be that far out of line with other towns. But as has previously been noted, this is about redundancy. This is about durability and safety, so that we have, if something happens to one person, we always have redundancy. So this is definitely something that we've discussed with the MPC quite a bit, and definitely, I think, something we would be proponents of pushing forward and recommending that we increase the budget to support at least 2 full-time staff. Larry, Will, or Angela, you have any comments?
Have you guys looked at recommending that we consolidate forces with the school K through 8 and basically try to increase our ability to cover more with doing that?
We have not looked at that. In general, the model, at least most of the towns around us, do not do that model. And I've heard some rumor, and I could be completely wrong, that this maybe has been explored in the past. One of my concerns, though, is combining with the schools. There may be sort of, I shouldn't say conflict of interest, but there should be conflict of concerns in terms of priorities. Town of Southborough versus the school district, et cetera, given that the school district covers a couple of towns. But it's something we could certainly discuss and look into. Sorry, Angela, you were about to say something?
I guess the thing that I would add is I joined the MTC recently and began working on some of the strategy work for the town. And that's involved a lot of interviews with different departments and groups around town. One thing I think we've seen is that Tom in his position had to do not only all of the day-to-day technology work, but there's not really the capacity for anyone to help the departments to think about their strategies. How do they not, become siloed? What are our opportunities for shared services across the different departments? So we're likely missing a lot of efficiencies that we could gain if we had someone who really had the time to devote more. Not to mention, of course, the additional load that stuff like remote working, as well as all of the new security requirements have, put on IT staffs. There's definitely the capacity of work there that's going to require certainly more than one person and likely in years to come more than two.
Larry,
So
you have a comment?
Larry's got his hand up.
Yeah, I just wanted to add to what Angela said, and not only is it a capacity issue, but it's an expertise or in essence a waste of expertise issue, because with a single person, we're talking about somebody who needs to be able to design server architectures for this town, network architectures for the town, and have that same person help people with fixing password problems or creating new logins. And that is, in a sense, a waste of expertise because you're effectively hiring the person for the high-end expertise and having that person spend a fairly substantial amount of his or her time doing things that a fairly entry-level person could take care of. So there's that aspect of it also.
Okay. So Matt, do you want us to, we can keep listening, or we can start asking questions now, but it sounds like you're not ready to say, yes, you need 2 people right now, for sure. You want to.
Well, I don't know. I'd love to get Will, Angela's, and Larry's opinion, but I think we're fairly certain that we would recommend 2 people. The exact skills of those 2 people we can discuss, whether it be one more senior person and one more of a day-to-day task runner, etc. Like Larry suggests. I don't think they necessarily have to be the same level, but having 2 for redundancy to me is foundational for durability of the service and availability of the service.
But would you guys also, as you debate this and try to really decide what you think job descriptions should look like for each, consider the school piece of it, because that would save us a lot of money, and that's a permanent savings if we could do that. We're looking for permanent things, not deferrals, which is what is our modus operandi. So I still think it's worthwhile. You may come back and say no, it just really is world. They really need to do their thing. But
we could definitely look at that. We can also look at outsourced, because there's a couple of towns that apparently use purely outsourced IT. But of course, keep in mind, this is not just a pure cost exercise, because there are implications of completely outsourcing your IT to a company. There's service levels that should be maintained, and I would want to get some strong referrals from the neighboring towns that are using fully outsourced IT to see what sort of challenges they've faced. Most likely there are challenges. So yeah, we could definitely.
We did that before Tom, you know that, right? That's what we did do. And then we hired Tom for the first time. We had our internal person. Everybody was very happy with Tom LaFlamme. It's just, he was stretched too thin. The public safety building, he installed all those access points there himself. He ran most of the Zoom meetings at first. And he was here at 7 o'clock at night with all these meetings. And so it made no sense, but no, we did have a firm. That's what we did before Tom is we outsourced it all.
Yeah. Okay. Yeah. We'll look into it and get back to you.
Right. So Tim, anybody want to weigh in on the 1 versus 2? Right now, there's nothing in the budget for fiscal year 22 to add any more than the 1 position, full-time position, and the part-time from last year.
So, I mean, all I would say to that is there's something to the argument of securing the right director and then working with them to decide what they need to staff out their department. So I think that was Tom's approach. I get it. At the same time, I completely agree that having a minimum of 2 professionals in that department is foundational. And even then, it only covers the basics of MIS. It covers your network, your endpoint service. It covers some of your infrastructure. That's pretty much it. It doesn't cover security. It certainly doesn't cover things like HIPAA expertise. So, I mean, ultimately, this is going to have to be a department that's staffed. Within the next 3 years, I would want to see at least 4 to 5 people in this department. I don't see how you cover the range of expertise needed and ensure that you have the right people doing the right jobs without that number. And you can get it regionalizing or not.
That's a great question. One of the questions I think I would have for the neighboring towns, which I can approach and ask, is how they handle HIPAA with their low-level staffing. When I say low-level staffing, I mean 2 to 3 people. There are definitely expertise required. I think one of our strategies would be to simplify the skill sets required for the positions via, I think, one of the next items on our agenda, which is shifting to more as-a-service offerings. So you're not constantly spending your time doing things like monitoring local disk arrays, and the less time you have to spend managing local infrastructure means you can potentially spend more time doing the true value add or the custom skills required to handle those, sort of edge cases such as HIPAA, et cetera. So, but it's something we should definitely look into.
So you want to go on to your next agenda item? If you think we've done everything we can on that one.
Yeah, any other comments on the staffing levels before we move on to the next agenda item? Okay. Shifting the town to cloud services. So this is definitely part of our strategy, part of the 5-year tech strategy. And Angela, do you want to comment on that portion of the 5-year tech strategy?
Sure. So I interviewed Tom before he left, and one of the conversations that we had was around what's the town's current position on in-house versus cloud-based apps. We actually do have a lot of applications that are cloud-based. So where we have the opportunity, the strategy has been to leverage software as a service, have the vendor provide both the application as well as the management and ongoing operations. Where we have tended to insource have been areas where either the vendor did not provide a cloud-based offering or where we felt that there was a security issue and we wanted to keep the data local. But that's an evolution. And even the stuff that we're keeping on premise today is likely stuff that we want to continue to evaluate. We want to continue to look at opportunities to move that to the cloud. And ultimately, as Matt said, we'd like to keep as little as possible local and under our own management and try to be as aggressive as possible about moving it to the cloud. There's likely more security than we could provide locally as a small IT group. There's less overhead and management that our IT professionals would have to worry about. And the robust scaling, the performance, the other attributes that we could get from the cloud are also benefits that we would see at a lower price point than having a continual capital outlay that the town has to carry in the budget. So from a strategic perspective, we're definitely interested in driving more to the cloud. But again, it kind of relates back to the staffing decision. We need a competent director who really knows these applications, knows them at a detail level, and can continue that ongoing evaluation.
Tim?
Thank you.
No, that makes sense to me. I completely agree. There'll be a core of services that will probably remain on-prem. Public safety, But otherwise, every opportunity we have to move to the cloud, we should embrace. I mean, that's what's happening in private, because that's, you have better service for reduced cost.
Absolutely. And regarding
Tim or Angela, are there any cons associated with moving to the cloud, either
Yeah.
from a security perspective or some other perspective?
Yeah. Even, just yesterday, my company's internet went down because, we have it hosted in Azure, and Microsoft had a hardware failure. So it went down. There was nothing we could do about it. It was out of our hands. But I think a comment was made earlier tonight that the way you handle that is with the proper SLAs. And ideally, your SLA has a credit feature.
Tim, dumb it down a little bit. SLA is.
Yeah, that's right. What is that?
It's a service level agreement.
Okay,
Yeah,
thank you.
It defines minimum uptimes. It defines a prioritization levels on your issues. It can define your QBRs if you have any, as well as any credits based upon failure of service.
How long were you down?
We went down for 24 hours, and then they came back up for 2 days, and then we went down for another 24.
That's surprising. I'd say, John, as far as your other comment, I'll talk English to you. There's a latency when you use the cloud too that you don't get when you're doing it right in your own network. But you get used to it, like everything else. You just get used to it, and then you don't remember how it was before, how much faster it was. So that takes a little bit getting used to.
For most applications, though, including even file sharing applications, it's unnoticeable. Like right now, we're going through the cloud. Our discussion right now is going through the cloud, and it's almost unnoticeable. And most modern apps are designed to be latency tolerant for the 50, 100 milliseconds it takes to get to your the cloud data center. And this is part of the strategy, right? Moving to the cloud, we would pick ideally local data centers. Local, I mean East Coast, US type things. So you don't not have to do transatlantic or trans US, so incur those latency. So, yeah.
Hey, Tim and Matt, in terms of comparative analysis, other towns go to the cloud? Do we know?
We don't know
No.
at least I don't know the journey of other towns going to the cloud, but I have done research into the public safety software specifically. Because obviously everybody's going to the cloud, including the software vendors themselves. So I actually reached out to a company that provides our public safety software, TriTech. We use this piece of software called IMC. They run our public safety dispatch, et cetera. And I asked them about their cloud strategy, and they say they're just now working on a future version, possibly released later this year at the earliest. That would be their first foray into clouds, because in general, public safety typically shies away from it. Because obviously any major natural disaster or major snowstorms, et cetera, take down internet lines, it's more likely to take out your internet connection. Now,
yeah,
there is also
Matt, one more question, and please don't think I know what I'm talking about, but if we move to the cloud, Tim or Matt, does that, or Tim in particular, does that lessen your prediction as to the number of full-time employees moving further, or is that apples and oranges?
I don't think it lessens the number, because in my opinion, the number of employees we need is based upon the expertise areas that has to be covered.
I fully agree with Tim. Yeah. And it's not a nature of number of servers. Ideally, you'd scale number of servers independent if they're identical in terms of independently of the number of employees. But like Tim said, it's number of areas. And right now we have a lot of different areas with one or two virtual servers each. So yeah. And just so for everyone's awareness, you can have redundant internet as well. But proper redundant internet is incredibly expensive. The right way to doing redundant internet is having two backhauls out separate sides of the building going diverse directions. And we don't have any building in our town that we'd have to do trench the back side of our public safety building and do some other path so that, neither side can be hit by the same outage. So it'd be incredibly expensive. Obviously, in the case of natural disasters, you can't depend on cellular networks, et cetera. So I think for some time there will definitely be a small number of VMs virtual machines we need to run on premise, but there's still within our current suite of virtual machines, there are some that we could move today, and that will lessen the need for the hardware ask that has been made for this next fiscal year. How much less that would be, we haven't done the calculations for, but yeah.
Yeah, another one of the things that concerned me when I looked at the budget with Tom a few months ago, the salary line item for the director to me seemed woefully insufficient. I just don't know how we're going to hire anybody competent that's going to cover the areas we want.
Agreed. I don't know if we've done a comparison with other towns. I do think it is low, probably most likely lower.
105,000 is what's in the budget for fiscal year 22.
Yeah. We have had applicants. Apparently they were very close. I think we possibly made an offer, close to making an offer to one applicant that they pulled out. And there's a whole new batch of applicants that I know Vanessa is looking into. So some of which I think have reasonable qualities, skills, but agreed, it is. I think we would do better if we had a higher budget.
Can I ask if is your team directly engaged in the interviewing process, the vetting process?
I am.
Good.
Yeah.
It's been 4 months, so it's getting pretty worrisome. Okay, so is this a conclusion that there really is no dispute that we should put on the cloud what's appropriate for the cloud? We know that the public safety software system, Jason has told us this too, there's really kind of one big one that everybody uses. It's not ready for the cloud. So that stays here, but much of everything else may be ready for it. So the chronological order is, the critical path is to get the IT director hired. This will be one of their major first tasks, is to help us start moving so that they can finalize what we really need for fiscal year 22. Until then, we're going to carry $40,000 in the budget for fiscal year 22. And that may get fine-tuned once the person gets hired and really gets a plan in place to do this. Is that a fair summary of where you guys are?
Yeah, that's a great summary.
Kathy, in that regard, since it's, kind of when the person comes on, would it be wise to just move that 40 into the general budget underneath the equipment line item?
Why would you want to do
It
that?
wouldn't carry year to year. So if he or she didn't come up with the right plan, or didn't procure the right equipment, or didn't implement it, it would go back to the general fund at the end of the year if they didn't spend it.
But they'd have a whole year, Jason, and this should move, you would think, pretty fast. So it sounds like, I'm not sure it matters, to be perfectly frank. You close it out one way or another. Either you automatically close it out every year, or you close it out when you don't need it. So I'm not really wedded to it, but I don't think it's much difference. But
my thought there, Kathy, was if it's in a capital item, it can only be used for servers, where if it's in the general fund, they might be able to use it for SaaS or cloud, or different things that they're thinking of.
Not based on the capital policy. That wouldn't work.
If it's in the replacement equipment line item.
But it'd have the intent of the policy would have to be that there was a discussion about it, right? Like of what it was going to be used for, because of the cost.
Yeah, for the spend. He could also do something for 5,000 here, or there'd be more optionality versus just the server expense.
Hey,
well,
guys,
don't you think we
got some real brain power here tonight. Let's not waste their time talking about things that we'll figure out on our own. They don't need to hear us debate whether it's going to go in capital or operating.
Well, I really do like what Andrew you're pointing at is the more flexibility we give the IT director in terms of steering some of that capital away from hardware expenses and possibly towards cloud services. That's a good thing.
I think you broaden the language. That's the simple solution. Just broaden the language. Don't call it servers, to make it more encompassing, to give that optionality.
Well, he's called it, so Tom's got in his budget that he left us with a line item called equipment. I don't remember what's in it. It's $26,000. It was 40 last year. So he's already got something in it.
It's
That-
20 workstations. So I'm just saying you bump that up to 46, or you bump that to 50,000 and move 20 more in software or something. I'm just thinking it gives them more flexibility, but it still has to spend.
Well, there was a line item, and maybe it's squashed already, but that there was a $80,000 line item specifically for server.
That's in the that's what we're talking about. It's in the capital
Okay.
budget.
So
So
two
that's what we're
different
trying to
things,
figure out is where it goes.
two different things. The 90 was in the capital budget. That's now down to 40 based on your recommendation. But separately, in Tom's operating budget, he's got $26,000, and Andrew says that's for 20 desktop machines, new ones. So I'm not sure if you guys are waiting on that either, but that's what's in there.
Yeah, we haven't discussed that at all or reviewed it.
All right. Okay. What else do you guys want us to know that we should know to try to do our job to make the appropriate recommendation to town meeting as far as making sure? Do you want to scare us about what all the things could happen as far as hacking and things that Tim Martell scares us about? Do you want us to go home and sleep at night, or do you want us to worry more than we already are about something happened to Little Southborough?
No, I completely agree with what Tim has already said. This is definitely something that worries me, and I think should worry everyone in town. Like, we shouldn't be asleep at the switch, and we need to be proactive about security and IT and technical infrastructure. So that starts with the staff. Yeah.
So it sounds like the critical path is to get this person hired. And if we don't have any takers in 4 months, even though we almost had one, he got talked to stay at his current job by his boss. It sounds like maybe what we're offering is not the right amount of money for this. I mean, what else can it be?
Yeah, completely agreed.
Okay.
All right.
So-
Yeah, Angela, Larry, or Will, are there additional items that we should be talking to advisory about?
I guess the question I would have is, what additional material would be helpful for you to support the ask? So if we want to move the salary from its current 105 to, whatever the new recommendation is, 150, 175, what do you need? Job descriptions? Do you need, references that for other jobs on the market out of, sites that would support that this is essentially a comparable salary range, or what would be helpful?
Well, I don't think we even know where this one came from as far as what they're offering now. I mean, did they just pick up where Tom left off and say, that's it? My guess is, I know Tom moved to a place that's closer to home, but I imagine he got a raise on top of it. So we're looking to you to say, this is what we think it's going to take to get a person that has the skills that we think that person should have. It sounds low to me. I mean, we all work in the private sector, and this sounds low to me to get somebody who really has the skills that we're describing here.
Angela, I always find it helpful to know what other towns are paying for the same set of skills.
The only thing I'll caution you, John, is that a lot of towns are very conservative, and they really look at IT as nothing but an MIS group, which is kind of like the view of IT from 20, 30 years ago. It's the guy that gives you your workstation and your servers and your network, right? And there's a lot more to IT today. And I actually think as we talk about these things, my guess is that we're being progressive.
Progressive, not regressive.
Progressive. Yes,
Well, I didn't know which one you
progressive.
said. I heard the aggressive, but not the.
Yeah. No, so I guess, comparing the salary to other towns will be helpful, but keep that in mind.
I mean, isn't the other way to think about it is if you're going to use private sector salaries, you need to imply a value of the pension that a public sector employee gets, plus no private sector employee has 75% of their health insurance covered. So, some combination there, right? So if you start with the private sector and it's X number, that might help bring the range, but I think the other thing is, right, getting personnel board on, on board with, if I don't think I'm not sure if this can be a contracted employer or not, but, they're the experts in the HR function of how to write a job title, and how to grade it appropriately to fit into the town's SAP.
I think a lot of private companies pay 75%, but what they don't do, they don't have defined benefit plans anymore, like the state pension plan is. So that's true for sure. The benefits should be factored in some form or fashion, but 105 just still sounds low to me for what we want from this person. So that's just my gut.
Yeah, completely agree.
Yeah. So maybe what advisory do is, we will, Betsy Rosenblum was here a few minutes ago, but she's gone. She's head of the personnel board. I wish she was hearing this. So we'll make sure that someone reaches out to her so that she reaches out to you to try to help get this done. Because again, it's been 4 months and it's not like somebody's lined up to start soon.
Kathy, can you remind me how the 105 was set?
It looks like, so I'm looking at the details. So this was Tom. So it looks like he was going to go from 102 to 105. He was going to get a, 2 point, he was going to get the COLA raise that SAP has approved. So I'm assuming, so I don't know this for a fact. So let me make sure this is clear. I don't know what they're advertising, what it looks like as far as what they're showing, as far as the salary range goes. I just assume it's something like that, but I don't know that for a fact.
Yeah, I'm
That's
pretty sure it's
the
105.
budget for fiscal year 22. Do you guys know?
Yeah, I'm pretty sure it's 105.
Okay. Yep. So they basically just picked up the number that was in the budget for Tom for fiscal year 22.
Yeah.
So, anyway.
And we have to be careful about that because it would be much easier to hire somebody for 105 grand that doesn't have the expertise we need. I mean, we don't need expertise in people setting up accounts and fixing passwords. We need expertise in people who can ensure security architectures, ensure that we're not subject to ransomware, ensure that our backups are decoupled from our online storage so that problems can't move from our online systems and take over our backup systems also. I mean, there's a large number of issues that I'm concerned about personally. And, a $105,000 person is not going to be the person who has the expertise and capability to deal with some of those things. And if we don't worry about those things, I think we're in trouble.
Well, it sounds like it sounds you're in unanimous agreement that the skill set of the person we need is beyond the 105. So, I mean, are we trying to fool ourselves that we may find a diamond in the rough, or how flexible is that number, Kathy? Do you know?
I'd like to jump in with just one question, which is, are we happy with the job description that we have defined? I mean, it sounds like there's a lot of sort of difference of opinion in terms of what the skill set should be.
The job description is, I helped revise it, and it definitely is a very much broader one now. And I think it actually is intended to attract people that are interested in learning new skills, including cloud skills. But I think the job description is fairly wide in terms of what it needs. All the skills that cover everything from infrastructure to application to desktop support, etc. Currently, Vanessa's working through a new round of candidates, and I think next week we'll know whether any of these candidates pan out.
Where can I get a copy of the job description?
It's on the Southborough website, from my understanding.
Okay.
So anybody else, we kind of did this in a little bit of a random fashion. Anybody else with any questions for MTC before I remind them that they've got a $1,000 budget to spend? So you've got 1,000 this year. Right now, there's 1,000 for next year. So that's what's proposed for your committee to spend on something that you might need to spend. So it's there.
We spent part of that money already with our subscription to SurveyMonkey, survey tool, online survey tool, which is what we're targeting with the Unified Southborough Survey on. So we've spent that earlier this year, and we'll probably have another subscription this year. I think it's a couple $100s, but yeah, thanks for the reminder.
Okay, all right. So Tim, I keep going back to you just to make sure that you think we've covered everything that we possibly can get from these folks tonight.
Yeah, I think so. I think, as John said, we're in unanimous agreement here. We all understand the problem and the path forward.
So I told Matt last night that town meeting looks like it's going to be no earlier than May. And it sounds like if you had to one to bet on when it's going to be June. So we've got some time to fine tune the stuff, hopefully get the person hired, get them on board, and really look at what the budget should be for next year, including what going to the cloud would cost versus, and then maybe not buying one of the servers, whatever. So we do have some time to fine tune this.
Kathy,
That's great.
so to just kind of sum up is what we're talking about here, that you know, we thought it would be a good idea to hire 2 people for the budget, which is now coming up, ending, right, FY21. But now it looks like we want to fill Tom's position, and then once that new person is on board, that new person can give input about what type of second employee he or she would like, and then that's something to anticipate for the FY23 budget.
Well, FY22 right now, remember Tom did this, you know, in November, so it was preliminary. He just kept the same people. He had himself, and then he had the part-time slot that he had never completely filled when he left. So that slot is still there. So we've got 1.5 people in this budget also for fiscal year 22 as it stands tonight. So yes, the person gets hired, the person then renders his opinion on how to do the cloud, what else he needs, and then we decide whether this, you know, what this budget should really look like. So we intentionally knew that this budget still needs to be worked on because Tom left in November. So it's definitely preliminary with a lot of assumptions in it.
Yeah.
Okay, so no one has anything else. Matt, thank you very much. Thank you, Will. Thank you, Angela. And where did Larry go? There he is. There you go. Okay. So we really appreciate what you guys do. I'm really glad we have an MTC, which of course we didn't have until a couple of years ago. And we will keep you guys posted. If you can keep us posted, that would be great.
Sounds good. Thank you for your time. I think Mr. Litt has some comment.
All right, so Jason, you want to bring Tim in?
Yeah.
So Tim, there you are.
Hi. So I just wanted to try and answer your question, Kathy. You know, if it's not money, what can it be? What it can be is setting up a job that has unrealistic expectations. You know, if you wanted me to go into a job that had no one else to support me, where I couldn't take a vacation, where I don't have support services, I wouldn't take it no matter how much you paid. So, I mean, I think it's not just a question of money, although I agree that you know, the thing currently in the SAP is way on the low side of what's required. I have other comments on the Board of Health thing, but I'll save those for the end.
Okay, we'll bring you back in and public comment on that one. Okay, all right, so thanks, Tim. Okay, all right, guys, nice to meet everybody in person, or at least on a Zoom,
Right.
and I'm sure we're going to talk again.
All right, thank you.
Thank you.
Thank you. Good night.
All right, good night. Oh, all right. Is it 1 step forward, 2 step back, or 2 step forward and 1 step back? I'm not sure. Okay. So we're right on time. So I say that. So all we're going to do for the rest of the night, we're going to, I'll do a quick chair report. We're going to do the minutes from last week, and we're going to talk about what we want to see in the mills tax warrant article, and we'll be done. Okay, chair's report, I've got 3 quick things. I sent you guys the copy of the email from Michael Weishen. He's withdrawn his plastics ban article for this year. He wants to make an indoor presentation. He just doesn't think the outdoor way we did last year is going to be conducive for him to present what he wants to present. So he is withdrawing formally his citizens petition for the plastics ban. The fee study that we asked, we wrote the BOS and asked them to consider doing is underway. I've been told it's almost done and about ready for presentation to the BOS. So we should be able to see it soon. So that it looks like they've done it. I don't know what it looks like, but it looks like it is coming to fruition. That's it as far as that goes. Okay, so that's chair's report. Let's go ahead and do the minutes from 2:10. I don't think they're going to take that long, so let's get those out of the way. We'll be all caught up with minutes. So Claire, are you there? Yep.
Good evening.
Good evening. Good evening. I saw you said hi on the chat. I said hi back. Tim said hi.
I saw that.
Okay. All right. I'll go around. It has who's looked at the minutes. So let's start with that first. Okay. So Andrew, you want to?
I have no comments. The comments that I made, I put into the draft that were circulated.
Excellent. Okay. You're out of the way. Anybody else look at them?
I glanced at.
I looked at them, Kathy. I have no comments.
Okay. Judy, any comments?
I have no comments either.
Okay. Jason?
I was not there, so I'm planning to abstain.
Oh, that's right. Sorry, Jason. You were fighting fires. Andrew P?
No edits, but I read them. Look good. Might be a first. Are we going to make it, Kathy?
No, I got a few. Sorry. But I don't have many. Tim?
No edits.
Okay, so I just got a few, so bear with me. John, Mr. Rooney, don't roll your eyes, please. Okay, line 58. I always want to put in this, I just want to say town clerk's proposed budget, until it's passed, it's not his budget, it's his proposed budget. So just add the word proposed between clerk and budget.
Oh, whoa. Sorry. Line 58.
Might be looking at an old draft, maybe.
Well, maybe I am. I'm looking at the draft that Claire sent me and said 4 pages.
61 on this one, Andrew, I think.
All right, so guys, help me. I'm looking, I guess, wrong one. So
Yeah, the one that I circulated on yesterday.
Okay, sorry, I did not print that one. I printed the one that Claire sent to me and said it's 4 pages.
Do we want somebody to
I
share
have
a
it
screen?
noted.
Okay. All right, you see where I'm talking about? They say it's 61. Okay.
Yeah.
All right, so everybody's going to.
Kathy, I have not seen the Claire edition, just so you know.
Well,
I've just looked at the Andrew edition.
The Andrew edition is improved. He's put his comments in it and made some changes to it. So it's the improved edition. So I looked at the wrong one. Okay, but that's what I did look at. So hopefully some of these things are already corrected. Okay, what was line 66, which may now be like 69, there's a misspelling, bringing, partially done by bringing. You got brining there, so just make a G.
My apologies.
Okay, you see that one? All right, same page under section 6. The line that was 82 is probably 84 or so. That starts out with example, if there was an emergency, that is flood or fire at Trotter. Let's see. Oh, okay, never mind, it's fine. I now get it what you're saying. Okay, so I got it. Never mind, it's fine. The next line down, simple should be simply. So it's probably line 84. Simply.
86.
86, okay. 86, Claire, simply instead of simple.
Got it.
Okay. Probably line 98 or 99 that talks about the SAP COLA.
Yes.
Okay, that's not, town clerk's not on the SAP, so get rid of SAP. So just put only had a COLA increase of 2.8%.
Got it.
Okay. Okay, next page under Articles 1, 2, 3, and 4, 4th sentence. As of now, for the last, just put 2 meetings. We've had consent agendas for 2 meetings.
Okay.
Okay. All right, there's that. Okay, that's it. So let's see, I tried one bad.
So Claire, did you get all of those changes? I didn't get all of those changes.
I just got all the ones that were just mentioned.
Okay, good.
Oh, there are?
Yeah.
Okay. All right, so let's get these approved. Someone make a motion, please.
I move that we approve the February 10 minutes as amended.
Second.
Any discussion? Roll call vote. Judy,
Bud's eye.
Cook, aye. Andrew D,
You didn't hear you, Andrew.
Andrew
Aye.
D. Okay,
Yes.
sorry. Jason,
Abstain.
Tim,
Aye.
Mr. Pfaff,
Aye.
and Mr. Rooney.
Aye.
Okay, so Claire, did you get it? So Jason abstains, so 601.
Got it.
Okay, all right, meals tax. So this is, because Jason wasn't on advisory last year, his better half was here. So let's just make sure that we're all on the same page as far as what we agreed to last year. And we were, I believe, unanimous on this. I could go back and look, but I think we all supported this. So it's a 0.75% increase to your meal check at restaurants, includes Starbucks, includes, anything that's kind of food related. So it's not just, fancy sit down restaurants, it's anything. It's Wendy's in town. So it's anything that you buy prepared food from. So 0.75, it's a complete pass-through. It does not add to the restaurant's cost. They have to collect it. They have to reprogram their software to collect it, and they have to remit it along with their normal sales tax return that they already do. They already collect 6.25% meals tax. So this is just added to it. So it's all one tax return. So once they do the upfront program the machine to add it, they should be in pretty good shape as far as not being any more burden to them. We surveyed several restaurants, actually just went in and talked to them, and for the most part, no one had a problem with it being added. Maro's was concerned at first, but once, we talked them through it, they seemed to be fine. House of Pizza, he was fine with it. He just says taxes are too high. I'm just against taxes, period. But I'm okay with this one. So there wasn't much pushback from anyone other than the guy that at that point owned Owen O'Leary's, and I don't know if he still does. He was trying to sell Owen O'Leary's back a year ago. So whether he did or not, I don't know. But he came to one of the BOS meetings and protested pretty vociferously about the addition of the tax. If we do it, so let's say we have a June town meeting. If you do it in June, it would be effective in October. You've got to give the various establishments time to get their software reprogrammed. So it's not effective, July 1st. So they've got a little time to get it rolling. We believe that once the restaurants are back with normal business after COVID, assuming they all survive it, they are able to open back up, that it's about $125,000 to $140,000 of annual revenue. So it's a year-over-year, increase. So we've actually, increased revenue for the first time in a long time. That's permanent. So that's what we're looking to as far as revenue goes. So that's the facts. That's the background. So let's just go around first. I know before we take a vote, if we're going to take a vote tonight, is there anyone that's changed their mind about supporting the meals tax?
Yeah, Kathy, I have.
Okay, so you want to tell us why, John?
I just think the optics in terms of the timing is not right. I think I'd be fully in support of it a year from now, but I'm somewhat reluctant to impose it right in October of this year.
So we're going to talk about timing, John. So that's part of the discussion. So what we
okay. All right. Okay, then I may still be in favor of it then if we're talking about delayed implementation.
Yep. So we're going to talk about that. We may want to recommend modifying the warrant article to do this in a way that is effective when we believe restaurants are, fully back in business and able to be normal, whatever that is.
I apologize then for taking up every 2 minutes of everyone's time prematurely.
No. I'm going to make it 3 minutes, John. Forget the timing for a minute. If I told you that the meals tax would effectively result in Southborough residents paying less tax because non-Southborough residents would be paying more sales tax, and there would be no net impact on the restaurants. Would you care about the timing, or would you just say yes?
Yeah, I'd like to see the data that would support that, though, Tim. Empirically, I'm not sure I get there just based upon that. I mean, is that in fact a data that we can rely on?
That's effectively what we're doing. I mean, Southborough residents who go to these restaurants will be paying the tax. However, non-Southborough residents will also be paying the tax. And this is, as Kathy said, an additional source of revenue, which will be functioning to lower the tax hit in future years.
He's
So
exactly right. We don't know the amount, but we do know there's a shift here from the tax levy to this. So we're trying to take some burden off the tax levy that everybody pays and shift it to people who come to Southborough from other towns. We go to their towns. We go to Boston. We pay it there. So we basically are, so I don't know the number, John. I don't know if it's 2/3, a tenth, but there's clearly a shift of the tax burden to out-of-towners that eat here by doing this. So totally agree with what Tim said. I just don't know what the number is.
And also under the one thing I didn't mention, John, is that I think most, if not all of our neighbors are doing it to us.
Yeah, we showed that every single one are, except for
Hopkinton. Right.
Yeah, and I called Hopkinton's treasurer, and he said that he was a new treasurer, and he said he wasn't really sure why not, except that he thought that when they just considered it in the past, and I guess they had considered it, they thought it was too big of a burden on their restaurants. And so I said, it's really not a burden on your restaurants. And so I don't think he really understood the tax. So I didn't put a whole lot of credence into what he said, but every other town around us definitely does. If you go to Starbucks in Framingham, you're going to pay it. If you come to Starbucks here, you won't pay it.
And I think I vaguely remember when the state legislature started to allow municipalities to do this. Was this something that's within the last 10 or 15 years, I think?
Yeah, and it's 243 out of 351 towns that have it.
And so after the legislature allowed municipalities to start doing this, it's not like restaurant business went down. Restaurant business consistently continued to go up until this shock. And so, my own view is I think I'd be even comfortable with going ahead with just the if town meeting approved it in the middle of June and it became effective in October. I mean, I know no one has a crystal ball, but I think we'll be in a better position in October than we're in right now. And it's not imposing Kathy, as you said, it's a pass through. So if a customer doesn't show up, you don't have to pay the tax. It's not a fixed cost at the restaurant.
No. So when the
customer pays the tax, pays it, you collect it, you give it the Department of Revenue, and the Department of Revenue gives it back to us.
That's right. We get it back from the Department of Revenue on a quarterly basis. Absolutely right. So absolutely right. So when you go into a restaurant and you get your check, you're going to see the 6 1/4 always added to it. Everybody always pays that. Instead, it's going to say 7% now. So what I kept asking, the example I kept giving, and this is when I gave the restaurant people, I actually walked into these restaurants and asked this question. I said, if a check was $100 before this, and now it's $100.75, do you believe that someone would make a decision not to come to your restaurant? And the answer, he laughed and said, no, you're just not going to see it. You're not going to feel it. You're not, so ask yourself personally, do you think in your mind, there's a difference between paying $100 and $100.75? You'd make a decision to go someplace else. But if you go someplace else, they have the tax too, unless you go to Hopkinton. So 243 towns have this. So we're in the minority as far as not having it. Now, I will also say too, if you remember last year, there was talk that the legislature was going to double what you could collect to 1.5%. They didn't, and my guess it's been tabled because of the virus. I didn't double check on that. But so we're talking right now 0.75%.
Kathy, I know I wasn't here for last year's discussion, but I'm a proponent of implementing it as, as currently worded, so it'd be effective in October. I think about it a lot the same way Tim outlined, but I'd also think about it this way: is have any towns, as a result of the pandemic, put forward an article this year to repeal the meals tax in those 243 towns? But I also hear Mr. Rooney's comments about, optics, et cetera. And I'm just wondering, maybe there isn't an optics issue if we just go and survey the restaurants that are open right now, and see, has their view changed? Because then it kind of answers kind of the only question I could see coming on this on town meeting floor. And you have the answer as opposed to guessing what the restaurants think. But I still am in favor of moving forward this and bring it to town meeting floor.
I would hate to go talk to the restaurants right now. They're suffering so much. I don't want to make that trip this time. I went in one the other night in Southborough. I won't say which one, and I was the only one that I was just getting takeout. And it's a place where there should have been a lot of people sitting down, and I was it. They were all sitting down talking. So I hate to even have that conversation right now. But I mean, if somebody wants to do it, you can. I can't do it again right now.
I mean, it's not going to sway my opinion. I was just thinking, for those that may have concerns about the optics, but I just don't think people see it in the check. And we also have to think about the advent of delivery services. There are probably people getting delivery services from our town, that live in towns that never would have come to Southborough before. And likewise, if you were to do the same thing and go to any of our neighbors other than Hopkinton, it'd be the same thing.
So Jason, I don't know the answer to your first question, whether someone has, put forth an article to revoke it. And that'd probably be hard if, down the road, you might see the number go, 243 go down, but I don't know how we get that currently without spending a lot of time calling town by town.
I just did a search and I didn't come up with any, I guess was my.
Okay, well, good.
To John's point, I remember last year, and I could be remembering this wrong, but that perspective was shared by several of the selectmen. So what can we do this time around to help them understand our perspective on this?
Hey, Tim, I think two things we can do. One is to, the public education based upon the comments that were made tonight. And two, I think by delaying its implementation to October also kind of softens that edge a bit, if you will.
So Tim, I don't remember the board of selectmen worried about the timing of the implementation. There was one in particular who didn't seem to totally grasp the fact that it was a pass-through. So I will say that. And I don't expect that to be an issue this time around. You've got different people on the board of selectmen this year. So I just don't think that would be an issue. Now, I don't know if they're going to support it. They may not support because of what Mr. Rooney said. That to me, that'd be the reason they wouldn't support it. They just don't, it's the optics. It's like, but I still think we can explain this. And then, if the town meeting doesn't like it, someone can stand up and amend it as far as the implementation. So we can support it to be implemented, pass at town meeting, implement it as soon as the schedule allows, and then, see what people say, and then gives, they'll have a chance to amend it. And if we ended up with even a divided vote, if Mr. Mooney says, I really want a delay in this, I like the tax, but I want a delay in it, that's not a bad thing to happen either. And, someone asked us to explain, why we had a divided vote, and we could explain it.
Kathy, would you be willing to entertain a motion on this?
Yeah.
Okay, hold on. I'm going to try to get the article number correct.
Kathy,
I just want to make sure Jason had all the background, because we were pretty in lockstep about this from last year. So,
Yeah.
You agree, Judy?
Yeah, I do.
You want to do a timing discussion just to get that out of the way?
Well, I think that I'm
heard
in favor of
Jason
just
say
doing it.
October.
Sounds like Jason is. Sounds like Tim is.
So why don't we make a motion, Andrew, and then with discussion, if somebody wants to suggest, we amend it per.
And I'm okay, here we go. So to make sure I get the article number right, talking about article, pardon me. I'm gonna find it, hold on.
32 for now,
Okay,
tentative 32. It may not be, you say tentative because I don't know where the plastics.
okay, so I'll say in the current, Article 32 in the current draft of the.
Yeah.
So I move that the advisory committee support at town meeting, Article 32 in the current version of the warrant, which is the meals tax bylaw.
Second.
Second.
All right, Judy seconded. Any further discussion before we vote?
Is there any delayed timeline associated with either that article or the motion?
Not so far.
That,
Okay.
John, that would be an October implementation date. I would recommend a 1/1/22 date. Make it sound further out, and it lines up better with the fiscal year of the businesses. But that's just, I mean, I'd vote yes for both. I think just optics wise, that sounds better.
Okay, so
fine
let's
with
see
either.
if the motion passes the way it's been presented, right? And if it doesn't, we'll then go back and see if we can get to pass with the 1/1 date.
Oh, Kathy, can I ask a question? I mean, if we can get unanimous support, should we take that route?
All right, so let's, probably not going to follow Robert's rules here. Does
I'm
anyone,
sorry.
would everyone agree? Well, is anyone opposed to 1/1 and insistent on 10/1?
Not really, other than I think that it's like we're learning from some of these, just delay doesn't really often just benefit us.
We
you
can
know?
always change this to, remember, we still have to, the town meeting's not till June, I think. We're going to know more about when restaurants are going to reopen, every month that goes past, more people are vaccinated. Things will hopefully be a little bit clearer as far as where we end up.
I mean, can we do this? We're basically, it would be a motion that we would approve it if there was this one change to it.
Okay,
Right.
so we've got a motion on the table. So who made the motion? Andrew, why don't you withdraw your motion?
I withdraw my motion.
Okay, why don't you make a new motion to approve the meals tax with an effective date of 1/1/22.
I move that the advisory committee support the meals tax, which is at Article 3 of the current draft of the warrant, with an effective date of January 1st, 2022.
Second.
Okay, Andrew Pfaff seconded, Claire. Okay, any further?
Just procedurally, did I hear you say Article 3? I think it's a 30 something, right?
I did at 32. Right?
I heard something different, but as long as we're clear, it's 32.
It is
That's
32. I know
32.
what he said. I assume he said 32. So maybe we heard the 3, not the 2. Okay, so 32, we've had a second. Any further discussion on a 1/1 effective date? Okay, let's vote. Andrew, Judy. Roll call,
Aye.
Judy.
Bud's eye.
Okay, Cook, aye. Andrew D.
Aye.
Jason,
aye.
Mr. Martell.
Aye.
Mr. Pfaff
Aye.
and Mr. Rooney.
All right.
Okay, so 7-0. So what I'll do is make sure the selectmen know sooner than later that's where we are at this point, so they can start looking at where they are on that one. Okay. So we got the standing items. I don't have anything to report on those. 1, 2. Okay, so budget. So I sent you guys today the most current Excel budget workbook, and we're in the 5s. And this is a pretty conservative one. I still think that there are some things that are going to change that don't impact budgets between now and say a month from now that will be favorable. But there are also some things that might go the other way. So we're just going to see, but it's definitely going down the right way. So 5 sounds a lot better than 9 for sure. So we cut it
Other
off.
than the regional schools, what do you think is going to change, I guess?
These are things I think are possibility, Jason. I believe that the overlay that Possibility wants in there for fiscal year 22 may come down further. It used to be $400,000 and he's got it in at 500. Now, I don't want to see it go back up to 500 next year. So again, it's one of the things you want to keep steady. But he is a conservative guy and he has hinted that it may come down further. He's already reduced it once. He reduced it from 550 to 500. So I think he may reduce it again. So that's one thing. 2, I believe that the local revenue local receipts that's used in the budget spreadsheet, which is not something we vote on, but it's in there. It's what you need to be able to compute the actual tax rate year increase. I believe that should go up. They don't have anything in there for the marijuana, the stuff we get from the pharmaceutical marijuana here, and we just got a check. So it's just falling into miscellaneous right now. They have not increased it at all from last year. So if you just bumped it up 3%, it'd be another $100,000. So if it goes up at the same rate as everything else goes up, it places less burden on the real estate tax levy. Now, I'm well aware, as I think we all are now, that this is where our free cash comes from. So I'm not saying boost it to what the real number is. Real number is $5 million. But I do think it should go up the same way the budget is. I do think it should go up and there's reason to. So I've been watching what's coming in this year and it looks fine so far. You don't see much of an impact of COVID. A couple things you do, but nothing serious. The excise tax is still half of that number for cars, and those bills just went out. So we'll see how those come in, see if people bought cars last year. But I believe that the car sales by the end of the year had popped back up in the country. So I don't know what that meant for whether Southborough fell in the same group or not too. So we'll see. So that's one thing, Jason. I believe the Youth and Family Services budget will come down $20,000 because the interface contract they want added to the budget is going to be funded through the Friends group that supports them. So I'm very confident of that one. So there's one. As far as other budget stuff, you heard what Board of Health said tonight, so I'm not sure where we are with that one, but if I had to guess, I bet that one comes down something. I'm not sure it comes down, the whole way, but I bet we vote on something that's less than what they're asking for, but I don't know for facts. There's one. Andrew Pfaff and I have done some work the last couple of days on what leasing versus buying some of the equipment on the capital plan would mean. So that's still yet to be fully determined. But if you look at what we think at this point, that would take a chunk off the fiscal year 22, maybe at least $250,000, maybe $300,000 as far as fiscal year 22 general fund impact. And you know what we're talking about there. So that's a big one. So it's a combination of things, but it's nothing that is asking people to arbitrarily cut their budget at this point.
So I guess the reason sorry, Tim.
Go ahead.
I was just gonna say, I guess the reason I asked was most of those items you just mentioned, I didn't even count 5 that we would actually vote on. Like, is there any reason we can't advance some of these budgets or, I know John in particular has asked almost every meeting about the BOS budget exercise. Like, can't we start locking some things down here?
Sure. Yeah, I think it still may be a little premature. So we're going to meet with the Board of Selectmen on April 13th to hash out any differences between what they'd like to see and what we have voted on. So we've got time. So if you want to go ahead and start, voting on things, there's some budgets that are easy, right? The town clerk. So there's many easy budgets here, and there's a few that are possibly still too high. So if we want to carve out the ones that we think are ready to vote on, we can certainly do that. And we are going to have to vote on them one at a time because there are several conflicts in this group. Andrew Pfaff has got some conflicts. John's got a couple conflicts. I've got one conflict. So we're going to have to vote on each budget one at a time. That's a fact. It's not going to be a big motion like we've done in the past. So if you want to start voting on budgets next week, I'll put together a list of budgets, send them around. You guys can reply to me directly as far as any edits to what you think you'd like to see voted on next week. And I'll put together a list of what we look like we agree on, we can go ahead and vote on and get out of the way, if that's what you want to do. So I'm looking at you, Jason.
I'd be in favor of that just because we've heard, I mean, other departments have done a phenomenal job, regardless of whether we agree with what they're presenting or not, like in terms of giving us the details. But I don't know that, absent a few, that we know where anyone stands, right? Like there might have been some departments that we applauded when they were here, but we may not be able to support their full budget for whatever reason. I may have one reason, you may have another. So I'd rather get those on the table, because if I think about the warrant closing in mid to end April, and we're going April 13th to the Board of Selectmen, we're basically giving ourselves one meeting to reconcile. And I can't remember a year where advisory and Board of Selectmen have reconciled in one meeting.
Well, that's the reconciliation. I'm not saying we're not going to talk to them ahead of time and start ironing out differences. So I'm just hoping by the time we get to that point, most of them are done and we're down to do one or two things. So, okay. So what you're saying is different from what I said. So if you want to just go ahead next week, we just go through budget by budget and say, yeah, we're ready to vote. No, we're not. We can do that. So then we know where our problem children are, and we set those aside for the moment and then deal with those one by one the following week.
Oh, because you may have to have the department head come back to answer a question, or someone the liaison go do research. So that's where I'm at, but there's 6 other members on the committee.
I agree. I agree with that proposed strategy and procedure, Kathy.
All right, that's what we'll do. My guess is there's probably half of them that we're going to say fine, and then maybe up to, it may not be that big, but at least half are probably going to be okay. And then things like Board of Health, IT, et cetera, we're not going to be ready for yet because IT is not finalized. For one thing, we can't vote on them yet. And then Board of Health, we know why that one's going to be an issue. Okay, sound good? All right. Okay, so I think we are ready for public comment.
I have one nitpick for you.
Go ahead.
On the fiscal year 22 articles capital tab.
Yeah.
The server line item, was that 40 or was it 45?
It's actually 40. They believe that the other 5,000 can be put through the operating budget as software or something like that. So they're saying 40 for the server. And I will say this, what I heard at the capital planning meeting on Monday, Matt said, it sounded to me like on Monday they had a server ready to be ordered, and I couldn't understand whether there's one or two. It sounded like an expensive server, but anyway, I thought it was ready to go. It's not. He's just saying, hold it. He thinks that's plenty of money there. That whatever we need to get is well within that, and let's see what we really need. Once we decide, we can go to the cloud. So it's not firm as far as what he thinks we should buy, but he thinks 40 is going to cover it. So it's a placeholder.
Got it. Thank
You
you.
agree, Jason? I mean, I just didn't, that's not the impression I got on Monday, but that's definitely what he said to me when I called him. And he kind of reiterated that tonight.
Yeah, I mean, my interpretation of what he submitted to Capital was, if town meeting were tomorrow and he got his 40,000, they're not going to be going out to purchase anything until they have a strategic plan and a new IT director to bounce it off of, is what I heard. But it's this balance of town meeting timing. If they don't put something in, then they're not going to get anything either. So
he just wants to make sure there's a placeholder there, Tim, to give them time to get this all worked out. And the 5,000, so he did say 45, or you saw 45 in his email, but the other 5, he thought they could basically pay for through the operating budget. So the 40 would be the hardware, and the 5 would be software and stuff to go with it.
Makes sense.
Okay.
Thank you.
Okay. All right, let's talk about calendar before we get to public comment. So right now we've got booked 3/3, 3/10, and 3/24. So we got to keep working hard. So I'm going to book tonight 3/31, 4/7, and then not 4/14, but 4/13, because that's Board of Selectmen normal meeting night, or at least a day of the week. They're going to have to meet on a special night because they normally meet on the 1st and 3rd. But so I sent Mark Purple an email and asked him if that would work, and haven't heard back. So tentatively say 4/13. So 3/3, 3/10, 3/24, 3/31, 4/7, and 4/13. Okay. And then
No St. Patrick's Day meeting?
What's that?
No St. Patrick's Day meeting? 3/7. That's the one where.
Well, that's, well, that's 4. So there's no 4. No, I tried to give everybody a little bit of a break here. I don't know about you, but that week that we had off was a blessing to me. So I'm trying to give everybody a little bit of a break because this is hard to do every week. So I didn't do it because of St. Patrick's Day. But I guess it is St. Patrick's Day, right? So you can have a nice St. Patrick's Day doing whatever you do. Okay. I did intentionally leave off the April meeting. That is the next school vacation week. So that's the week after the 13th. So I did leave that one off for sure. Okay. All right. Anybody have an issue there? And I just want to compliment this committee. Everybody is here every single time. I don't worry about a quorum like I might worry, given that only 2 people can miss before we'd have a canceled meeting. So you guys are great about coming, but don't forget, let me know if you're not, so I know if we do have a quorum problem. Jason made a comment at a meeting recently that he used to be very worried to the very last minute at the public safety committee meetings because we had 9. And when you have 9, I still think it gives people a little bit more, they're a little bit more lax about coming because I think there's plenty of people there without them. It's my psychological analysis of 9 versus 7. Okay, let's see what our public wants to say. So any public comment? Can you bring Tim in, Jason?
I already had my finger on the button, waiting for that hand. There he is.
Okay, I think I'm here.
You are. Welcome back. So Tim, sorry, I really was trying to stay on a schedule with Board of Health, and so not to keep MTC waiting, which we still did. So I'm sorry I didn't bring you in when they were
Well,
here.
I understand. I just thought it might make sense for me to talk about the Board of Health while they were still there. But I've sent a note so they know what I'm going to say in any case. So it may come as a bit of a surprise that I pay attention to the Board of Health, but I do. I've been following them reasonably closely for 2 to 3 years. I'm as much of a pain at their meetings as I am at yours, maybe a little more. So a few things that I think Mary Lou and Heather missed in their conversation with you, I wanted to talk to you about. First thing is that their plan is not out of left field. It's not driven by COVID. In fact, they've been working on it off and on for about 2 years that I know of. We've been trying to figure out now how do they catch up and have a department that does what it needs to do.
Tim, if that's the case, can you answer or quantify what percentage of their increase is non-COVID related? I mean,
Well,
I'm not sure I got an answer to that.
Well, my sense on this is that most of the COVID stuff is actually being carried by the per diem nurses and that, additional work. I started actually putting together, sort of a straw man slide set of, if I were on the Board of Health and I were trying to, put something together, what would it look like in terms of, checks, X's and halves in terms of their 60 odd responsibilities, what's actually done and what isn't. And there's a surprising amount of stuff that they managed to get done. And there's also a surprising amount that they didn't. But I think to do their core function, what they're asking for is a very conservative request. And it may actually be too conservative, but at least it's a start. I would say that, the department got by with people, and that's, Leslie, Paul, Emily in particular, who worked well beyond what they were paid for. And every one of them now has retired or resigned. And I think part of what they saw, and I saw it at their meetings, was, the frog in cold water over a slow fire problem, right? I mean, requirements kept coming down, incremental work, kept showing up, and everyone said, well, we're the ones for here. We'll put our shoulder to the wheel. We'll do a little bit more. And, if we don't exactly get paid for it, well, we don't, but somehow we've got to hold things together. And the town benefited from that up until the point that, people aged out or gave up. And my observation is that while you can do an awful lot that way, it's really hard to hire a frog who's going to jump into the pan of boiling water, right? I mean, people may not notice it, as the temperature slowly rises, as, Samuel Clemens put it, but asking people to, jump into where they are now is not likely to be really successful. I would say that, the Board of Health fought a really valiant holding action, but because they didn't have a strong public health director, that is someone with a master's in public health, and, the board in previous years had physicians on the board who had a little bit more time to devote than Mary Lou did, although she managed to do quite a bit. The bandwidth just wasn't there to bring the plan together sooner. And I also think because they didn't have the bandwidth, they didn't see how deep the hole had become.
And she said that, she admitted that.
Yeah.
So John, the reason that she gave her background, I actually asked her to. I said, Mary Lou, I didn't realize you had such an extensive background in public health. I thought you were a nurse. And she is a nurse. She's a nurse for 15 years. But since then, she's done all this other work in public health. So I said, I think it's important that you reiterate that to the committee. So that's why she did what she did, not because of any other reason.
Yeah, so I think, I have a couple of other things and I wanted to say about this. One is I strongly agree with Mary Lou that, yes, regionalization is a really good thing, and it is impossible without having the core staff. I mean, you can't go up to another organization and say, I want to share resources with you, but I don't have any. I want to hire people, but I don't have the staff to coordinate with. And that's sort of the situation that they're in now. And the last thing I wanted to talk about is that just as we identified a big key man risk in the IT department, we have another one that's happening in the Board of Health. The Board of Health records today are in filing paper. They're in paper form. They're in filing cabinets. The index is in Paul Pazinski's head. Paul is fading out. We dismissed him as the public health director. He's now a few hours a week in transition, and eventually, he'll go. I think, if he disappears, that risk will materialize in terms of the ability of anyone to get their job done. So I certainly would expect that in future budgets, converting that pile of records, that you need, that's where you go when you want to dig up your septic system, or you have to dig up your septic system, among other things. So I think you should expect in future budgets that conversion to electronic records will happen. And that also isn't going to happen with part-time people who are working beyond, what the hours in the day allow. So, I mean, I'm not known for, wild spending or jumping in to support very many things in town, but this is one that I think is really important. And I think it's important to remember that, public health is a public safety function. I'm the one who came up with the triangle metaphor for it. You have police, you have fire, and you have on the bottom, you have public health. And I put public health on the bottom because if you don't have public health, it really doesn't matter. If you're not alive, you don't care about crime. You don't care if your house burns down. And, we have more people dying from public health issues, fortunately, than we do from fires in town, or we do from criminal activity in town. I'm not saying we should increase those, but I am saying, the fact that public health has sort of bumbled along and done the best it can for the past 10 years or so. We've been lucky up until now, and it's really time to seriously support the board in what they're trying to do. That's my
Amen to
lecture for the
that.
evening.
All right.
That's a good lecture, Tim.
All right.
Amen.
Thank you, Tim. All right. Anything else anybody wants to bring up before we adjourn? All right. Motion to adjourn.
I move we adjourn.
Second.
Second.
Andrew Fast seconded. Any further discussion? Roll call vote. Judy?
Aye.
Cook, aye. Mr. Dennington?
Aye.
Jason?
Aye.
Mr. Martell?
Aye.
Andrew P? Did Andrew P say yes?
Aye.
Okay, I didn't hear you. Sorry. John?
All right.
Okay. All right, guys. We'll see you next week. And we'll talk about budgets.
All right.